3 pieces of radiator because of problems that we've had, none of which are to be on the fault of the contractor or the project team or this side of the fence. It's material related. We ordered a piece that was supposed to be 4 feet, and ordered a piece that was supposed to be 12 feet, and it showed up 4 feet. So we're in the process of cleaning up punch list items, basically. There is, in the punch list column, there is an issue with the horizontal enclosure that covers piping in between radiator and around corners and around columns, like the one you see in the middle of the room back here. A lot of that needs to be reevaluated. Several pieces have shown up and they don't look like they're the right size or shape. And we are addressing that today at 11:30 downstairs. It should not prevent a turn on of the system. It's a mere cosmetic issue. And where we can allow people to start to put their lives back together in terms of their office spaces, we'll start doing that as soon as we can feel like we can clear an area and let people get back to order. I certainly hope to be out of here in a month, but there are probably likely to be a few cosmetic issues because of this factory issue that we have with the horizontal enclosure around columns. But certainly the majority of the crew and the mess should be gone here by the 1st of February, or thereabouts the first week of February. So things are progressing just like we expected. So I'll have a more detailed update for department heads tomorrow, but that's basically what I have to share with you today. Are there any questions?
It just sounds like there's a couple of cosmetic items. There's really nothing.
No, nothing functional.
Right.
In other words, the problems that we're having are not uncommon. They're frustrating because to me, when you measure something, the rule is to measure it twice and cut once, right? And that's the kind of problem that we're having right now. And we went to great lengths. A lot of people involved, a lot of hours involved, a lot of counting, a lot of auditing, and we still have some problems with these enclosures. So.
I do want to compliment the staff working here. They have come in 6 o'clock, they have come in at 5 o'clock. When we tell them there's a meeting going on or a room needs to be used, they have adjusted. They have stayed after 5 o'clock to do work, and they're very professional, very courteous.
Yeah.
So that's been a positive thing. When you have all these people here in the building every single day working, when you do these type of projects, there's going to be noise. But we had some major trials upstairs. They worked around that. We've had meetings. They've worked around that. You don't hear any noise this morning on purpose. So they really have been very, very good. And they've been very courteous with our staff here, too.
Yeah.
So we appreciate that. So tell them thank you.
So it should be just a little while longer. I hate to sound like a broken record, and hopefully I'll sit here next month and say, it's just going to be the balancing guy that's here from now on. So, but everything seems to be, progressing just fine. Okay?
Thank you.
Thank you.
Okay, so then that would bring us then to the Conservation District. Mr. Long is here.
Good morning. I'm Buzz Long, the Executive Director with the Leelanau Conservation District. I want to thank you for the opportunity to give you an update on our activities. One of the big activities last year, and you probably are aware that it was our 75th annual year of being in operation in the county since 1943. We had our 75th annual celebration at the Leelanau Lodge on November 8th, and one of the highlights of that was to receive some letters from some of our representatives. The state of Michigan sent a special tribute. And don't want to take the time to read all of them. We also received this was written into the congressional record from the House of Representatives from Representative Jack Bergman, and I would like to read that. Kind of gives us a pat on the back. Celebrating the 75th anniversary of the Leelanau Conservation District, Representative Jack Bergman of Michigan in the House of Representatives, October 31, 2019. Madam Speaker, it's my honor to recognize the Leelanau Conservation District as they celebrate their 75th anniversary. Through its dedication to responsible natural resource management, land conservation, and healthy environment, the Leelanau Conservation District has become an indispensable part of Michigan's 1st District. As an avid outdoorsman, I recognize the importance of protecting our wildlife and natural resources through effective conservation. In that endeavor, the Leelanau Conservation District has been invaluable to northern Michigan. First organized in 1943, the district works to promote the wise use of our natural resources through information and technical assistance to those throughout Leelanau County. From promoting healthy forests and responsible hunting to fighting invasive species and preventing soil erosion, their work has been critical for the people of Michigan's 1st District. Our region is home to some of the most pristine natural landscapes in the country. I'm grateful for the Leelanau Conservation District's effort to ensure that future generations can enjoy the same natural beauty we so deeply treasure. Madam Speaker, it is my honor to congratulate the Conservation District for 75 years of service. Michiganders can take immense pride in knowing that the 1st District is home to such a trusted organization working to promote environmental and ecological health. On behalf of my constituents, I wish the Conservation District all the best in future endeavors. So, I'm pretty proud of that. Moving on to one of our other big programs is the soil erosion and stormwater control permits. For the 3rd straight year, we have broken records for the number of permit applications that we serviced. This year we serviced 570 permit applications. That didn't just break last year's record, it blew it away. That's 86 more than we had in 2018. Because of we've hired Dan Oriza, a natural resource conservationist for us, working 4 days a week, and in July of last year, he was certified and is helping us out with servicing these permits now. On that same note, already in January, we are 9 permits ahead of last year's number at this time. So we're kind of hoping that that's not a trend, but it may be with all the shoreline erosion that's taking place. Because of that, we're working with Eagle, the state agency, on putting together a workshop on lakeshore erosion on the Great Lakes, and hope to be holding that. We're just at the beginning stages of getting that put together, but sometime probably the end of February, the first part of March. Another program that we've been involved in for years, the Forestry Assistance Program. Again, we're funded through the state, through the Michigan Department of Agriculture and Rural Development, and have received the funding for 2020 for that. We are the fiduciary for it, and the main location for the forester. I'm sure you're familiar with Cameron Ross, who is our forester. Serves Leelanau, Benzie, and Grand Traverse counties. Last year, over 40 educational workshops were held and participated in, covering everything from how to plant trees to basically how to handle taxes after you've cut trees down and produce some timber. In fact, there's a workshop tomorrow evening at the Nature Center in Traverse City on that exact subject, timber taxes. Also provided over 150 on-site technical assistance visits to landowners, with 75 of those resulting in referrals to the private consultants to develop plans for harvest and for future forest activities. Another forestry program, and through the forestry program and through the Conservation District, we hired a forestry intern last year, Maddie Baroli, who was finishing up her Master of Forest Conservation degree from the University of Toronto. Maddie was with us last year from May through the end of August and really brought a new insight perspective to our natural resource concerns as she worked with landowners. She was truly a pleasure to have with us. As part of her degree, she had a capstone project. Her project is called the Assisted Tree Range Expansion Project, or ATREP. There's a little flyer for it, and just to explain a little bit of what it is, a simplified definition, assisted range expansion is the human-assisted movement of species to areas just outside their established range in response to climate change, facilitating or mimicking natural range expansion. So through the Conservation District, we're assisting her in her project by providing 6 species this year. That 2 of the species we've offered before, but there's 6 new species that will are more. They're not native to northern Michigan, but are native to mid-Michigan and southern Michigan. Those will be hackberry, black gum, sassafras, and shagbark hickory. The 2 that we've offered in the past are swamp white oak and tulip poplar. So that program will be started. It'll be a landowner science-based thing where they will plant the trees and monitor their growth over the next 5 years. So it should be an interesting project. We also have hired a communication specialist wanting to upgrade our website and provide some more news ads, newsletters, upgrade our newsletters, and plant and sell merchandise flyers. So that's a part-time position, really just 1 day per week. Should be working mostly off campus, not here, but we'll be providing her with information and upgrading. We did just start a new website, and so getting that up and running. We also just had the opportunity to be the fiduciary for a farm bill specialist who will be basically doing the paperwork for the Natural Resources Conservation Service programs, where they do cost-sharing programs with farmers, landowners, and this will allow the field personnel, Jason Kimbrough, Megan Seabright, out of the Traverse City office, to basically get out in the field and not have to do all the paperwork. So that's going to be, we'll be advertising that position. We'll be the fiduciary. The position will actually be in Traverse City, where they will be positioned. And then we're also doing holding the director workshops for the Michigan Association of Conservation Districts. That will be in March. The workshops will be held here at the community meeting room. There'll be 2 workshops, a short form, one evening, and the next day they'll have a longer form of it that other district directors can come. It's designed mainly for new district directors from all the conservation districts in northern Michigan, but we'll also provide an opportunity for the veteran directors to come and get refresher. MACD is continuing to work with the Michigan legislature, hopefully to again provide operational funding for conservation districts, which we haven't had from the state for several years. And to To close up, we're in the process of publishing a new plat book this year for 2020. The old one was a 2017 version, and we're down to a bare minimum of those left, so I thought it would be a good time to get a new one, so that'll be taking place. Other than that, we're doing our normal work, the no-till drill, all the things that we do. So, if there's any questions?
Commissioner Whitman.
How long have you personally been with the Conservation District?
Not
Not 75 years.
No. No. I started, this is the beginning of my 12th year. I worked for the Natural Resources Conservation Service, federal agency, and retired from there. And then when Judy Egler retired from the Conservation District, I retired from NRCS and took this job. Told them at the time I'd do maybe 4 or 5 years. Like I say, this is my 12th.
We appreciate it.
Well, thank you.
Commissioner Rushton.
I have a question for you, Buzz.
Sure.
You said that you have engaged the services of a communications specialist
Yes.
to do the website work. This person's part-time 1 day a week, and he works off campus. Is he an employee, or is this a contract?
It's a contract position,
Okay.
yes. Yeah, it's her too. Amay Marazan is her name. She works with the Benzie Conservation District also.
Okay. I wasn't clear on that, if he
Yeah.
was an employee or...
Sure.
Thank you for the clarification.
Commissioner Answer.
Buzz, you have an item, our item for potential approval of annual district work orders. In preparation for that, one of my questions is going to be,
Sure.
what's in your budget for what you're requesting? So you can prepare for that when we get to that point. Thank you.
Sure.
Any other questions?
One
Commissioner?
quick one. Buzz, when you do your plat book, when is the deadline? So can we get a change or a correction from the last plat book for this plat book? Is there still time to get a correction in there?
I'm sure there is. If you have something that you know is wrong, let me know and I can contact the publisher.
Okay.
Yeah.
I'll get with you then.
Sure.
Thank you. And I love the plat book.
Yeah.
It's a great resource. If nobody, I don't know how anybody gets by without their plat book. I use it all the time.
I know what you mean.
Especially the old ones.
Love all the other ones.
I just had one thing. I wondered, you talked about all the soil erosion permits.
Yes.
And do you work with the tribe in that? Do they have, because I know they have their own sort of natural resources commission?
Correct. Being a sovereign nation, we don't control anything on their properties.
Right,
We don't.
I know that,
Okay.
but don't we work with them or collaborate
Well,
with them or anything, or nothing?
If they've asked us, we have in the past, but we don't do anything
Okay. I just
in
want-
general.
All right, thank you.
Mhm.
Thank you very much.
Thank you.
And then Mr. Christensen isn't available as drain commissioner. He'll have to be here Tuesday. He said Tuesday night. He had to take off. So then that would bring us to the approval of the agenda. I have no late additions or deletions. Commissioner Atsorgi?
I move to approve the agenda as presented.
Support? All those in favor?
Aye.
All those opposed? The motion passes 7-0. So then that brings us to public comment. Please come forward.
Hi, I'm Barb Conley from Northport, and this commission had appointed me as the at-large member on the Benzie-Leelanau District Health Department, and I must say it's been an honor to serve there. It's a wonderful organization. By training, I'm a medical oncologist, and until recently was an associate director at the National Cancer Institute, in which we had to implement many programs across the country for the benefit of people's health. Mostly these were clinical trials to improve the treatment for cancer patients. But I have to say that the implementation plan and the ramp-up plan that is presented by the Leelanau District Health Department for the early childhood was a very professional document, very thoughtful, and I appreciate their expertise in doing this and building it upon the expertise that they already have as a health department. Thank you for listening.
Thank you. Any other public comment? Please come forward.
Hi. My name's Laura Tui, and I'm a resident of Empire. And I'm a parent to a 1-year-old and a 3-year-old, and I also live and work in this community. And I just wanted to say thank you to the commissioners and to the community for your support of the early childhood millage, and that my family is really looking forward to using the programs and services that result. Thank you.
Thank you. Any other comments? Please come forward. Okay.
Tricia Denton, Cleveland Township, and I have public comment on a number of things on today's agenda. So I'll be wearing several different hats, as usual at most of the meetings that I attend. First, as the president of the League of Women Voters for Leelanau County and a parent who previously received early childhood services through the Parenting Communities program, I would like to speak on behalf of the League. I think I shared with you at an earlier meeting when the millage was being considered and the board had formed the 40-person group to investigate the millage. And I'll just share with you again that the League has a position on that believes that the early intervention and prevention measures are effective in helping children reach their full potential. The League supports policies and programs at all levels of the community and government that promote the well-being, encourage the full development, and ensure the safety of all children. These include child abuse and neglect prevention, quality health care, including nutrition and prenatal care, early childhood education, developmental services emphasizing children ages 0 to 3, family support services, and violence prevention. And further, under our health care positions, we have several items that speak specifically to early and affordable behavioral health diagnosis and treatment for children and youth from early childhood through adolescence, early and appropriate diagnosis and treatment for children and adolescents that is family-focused and community-based, and health education from early childhood throughout life that integrates all aspects of social, emotional, and physical health and wellness. I thank you in advance for your making every effort to help the implementation of the past early childhood millage to be successful in our community. On to another hat, but a different topic, or same hat, but different topic. Much later on your agenda is consideration of a letter that was submitted by myself and on behalf of the League of Women Voters this year, 2020, marks the 100th anniversary of the 19th Amendment to the U.S. Constitution, which made it unlawful to deny a person the right to vote based on their gender. After the amendment was ratified by 36 states in August 1920, its passage enfranchised 26 million women, allowing them to vote for the first time in the 1920 presidential election. Today, that number is nearly 126 million and constitutes 51% of eligible voters. The League of Women Voters of Leelanau County would like to recognize the 100th anniversary of female suffrage. To do so, we request the opportunity to plant a tree on the grounds of the Government Center this spring. Further, we propose a plaque being placed near the tree to detail the tribute. We hope both our elected representatives and our election officials can participate with us in this commemoration. The League of Women Voters of the United States grew out of the suffrage movement and will also be celebrating 100 years in 2020. ensuring that every eligible voter has the desire, the right, the knowledge, and the confidence to participate remains foremost in the mission of the League. Today, there are over 700 local leagues in all 50 states, having more than 400,000 members and friends. Here in Michigan, the League of Women Voters of Leelanau County is one of 27 local leagues with over 4,000 members and friends. If our request meets with your approval, the League of Women Voters of Leelanau County Board of Directors could complete this project with direction from our County Administrator, Chet Janik. The League of Women Voters of Leelanau County would cover all expenses related to the tree, its planting, and the commemorative plaque. The League of Women Voters of Leelanau County thanks you for your consideration of our request to establish a lasting and living tribute that recognizes the hard-won fight to ensure votes for women, as marked by the 100th anniversary of the ratification of the 19th Amendment. We also thank you for your service to our county. And then my last
Well,
hat.
your 5 minutes are up.
Oh, I'm sorry. I just wanted to point out that I brought a brochure that's available on the table, and I also have copies for each of the commissioners. This is an educational brochure that was produced with the remaining funds for the
Just give them to Chet, we'll then pass them around. But yeah, we have to go on. All right. Thank you. Any other public comment, please come on.
Good morning, Commissioners and Mr. Janik. I'm Jan Frazee. I live in Centerville Township. So I'm going to stay on script. It's better if I do it that way. First, I wish to thank you all for your service and your time here, and to all the citizens in this county. I'm here today to ask you to support the offer from the League of Women Voters to plant a ceremonial tree on the grounds of the governmental center. The gift of a tree is to commemorate the ratification of the 19th Amendment to the U.S. Constitution, which was ratified 100 years ago this year. As you are aware, the 19th Amendment gave women the right to vote in the United States of America. It was a hard-won right that most people today just take for granted. Without the right to vote, many of you commissioners and many of us women sitting in this room today would have little, if any, voice in our government. Planting this tree would be a significant celebration in a time when our country is in need of events to bring us together in a nonpartisan manner to celebrate our democracy. The ability of all citizens to vote in elections is a cornerstone of a free and democratic society. So please support this offer and join the celebration. Now, this is an on-script, but I also want you to know that I'm a retired nurse practitioner, and I have worked with Leelanau Health Department and Grand Traverse Health Departments off and on for many, many, many years. And I think you need to know, if you haven't heard this already, that Leelanau Health Department is one of the premier health departments in the state. Their staff, their administration are some of the best. So I have full confidence in their ability to implement the early childhood education project. So I just really hope you all support them in this endeavor, because, you know, that's what the citizens of this county have voted for, and we're behind them 100%. Thank you very much for your time.
Thank you. Please come on.
Good morning. I'm Sue Miller from Leland Township, and I'm here to speak to an issue that several people have already supported, and that's the early childhood millage. And I'd like to thank all of you for moving forward in planning the implementation of the programming resulting from the recent vote. I look forward to seeing our health department assuming responsibility for broadening its service to our youngest population. The department has the administrative expertise and the experience for the task, and has built-in oversight by our county's Board of Health, the Benzie County Leelanau Board of Health. As enthusiastic as I am about our county's leadership in the area of early childhood, I am puzzled about the continuing references that have been made by several commissioners regarding the November election. The assertion that no one knew about the millage continues to come up, and I'd like to put that myth to rest at this point, because I think it's simply false. I participated in the 42-member committee that studied current early childhood programming in the county and made recommendations to address the gaps in service. I was also a member of the Early Childhood Development Committee that had responsibility for scheduling presentations around the county and developing the content to explain how the recommendations originated and what early childhood programs could do for families. We also described what the millage would fund and the cost to voters. Our goal was to provide information to prepare voters to make an informed choice, and we did not specifically recommend and support or non-support of this issue. We reached out to voters in every way we could, and presentations were made in all but 11 townships in the county. They were made at county board meetings, at all 3 of the village board meetings, and all of the school board meetings. Additionally, presentations with advanced public notification were held in Suttons Bay, Northport, Leland, and Glen Arbor. Presentations were given to multiple nonprofit and service groups, various women's clubs, book groups, and several churches. A website with information on the millage and early childhood programs was created, and social media was used to share information and announce presentations. All 4 of the schools carried information in their newsletters, and 3 local newspapers carried articles and forum pieces on the upcoming election. Those who did not support the millage also campaigned, informing voters through yard signs, flyers, talk show participation, and a community forum. I'm not sure what else could have been done to reach the voters. It's not unusual to see lighter turnout on a specific issue election that typically brings out those who really care about the issue, either pro or con. However, it's noteworthy that the actual turnout in our county ranged from a low of 23.4% in Solon Township to 51% in Leelanau Township. 6 out of 7 townships where the majority of families with kids live, and the city of Traverse City voted for the millage. The issue only went down by 8 votes in the combined Elmwood Township groups, but by a larger margin in the 4 farming communities where owners of larger parcels had voiced their opposition. Now that the voters have spoken, it's time to move forward in a united manner with their decision for our children. I want to thank you again for your efforts to make early childhood services in Leelanau County another reason for families to locate here and families to thrive. Thank you.
Thank you. Anyone else? Any other public comment? Seeing none, and we'll move on to our action items. And the first one is the 2020 Blue Cross Blue Shield insurance renewal. Mr. Walters is here. Help me pass this out. Sure.
Good morning. Thank you for making me first.
At 11:20. First, you don't understand first.
I'm beginning to feel like Chicken Little every time I come to talk to you guys. There are big storm clouds surrounding the entire health field. We have issues with state, we have issues with federal, and standing in the middle of that big swirling storm is you guys. Last year, we projected your cost to be $1.751 million for the health insurance for your employees here at Leelanau County. As you know, we've done this often enough now. We don't have December and January yet, so we use December and January from a year ago to make sure you're on a 12-month running average. Right now, we are at $1.627 million. That's $123,949 under what we projected this budget was going to be. I have no idea how that happened. The projected cost for 2020, according to Blue Cross Blue Shield, is $2 million. But because I've done this long enough and we all know how the system works, I suspect we're going to be right in the $1.7, $1.8 million range again. They build into your anticipated claims and things something called trend. Trend in the storm is running over 10%. That's a big number for a lot of groups. The little groups are getting whacked this year. They're running up to 15. I've seen them as high as 75. So once again, we're holding the line. A big part of that is we do the employee meetings. We have great attendance. Your employees are extremely well versed in how this works, and we just remind them every year what they can do to help, and it has been paying off. Our stop loss fee is going up because, I'll explain in a minute, from $620 to $691. It's an 11% increase. The reason for that is because we had a cost of $737,000 for stop loss, but they paid us back, literally claims not paid, at $972,000. So that money you spent actually came up with a net gain, if you want to look at it that way, of $235,000. That resulted, a lot of it, from the fact that you guys a couple of years ago voted to raise your stop loss to cover those drugs. We have several drugs being used here that are in the $100,000 range. The county is only paying $20,000 and they're done with it. Okay? The administrative fee is going from $71.85, or will be $71.85. It's a 1.8% increase. So Blue Cross has somehow figured out how to do administration better, I guess. Usually they've been running 2.5 to 3. The total administrative fee you paid was $83,777. A few years ago, you voted to increase your administrative fee and put your access fee in there. That's the discounts to the doctors and hospitals. With that agreement, you get 100% of the discount. That resulted in $1.391 million you did not have to pay in claims made. So the best bang for the buck you guys have ever spent on anything is that administrative fee. We listed down there and showed you the last 5 years of prescription costs, and you can see we had a slight increase, but not much, for the amount of drugs that we ended up using. Your employees know about GoodRx and they're using it. So everything says I'm a liar again, because this can't be happening according to even the people that send me the numbers that I present to you. But the bottom line is, for some reason, we have held the line again. I've talked to Jen a little bit about, talked to you guys a little bit about starting to put some money off to the side here. One of these years, we've got to get a higher expense. This just shouldn't be possible.
Commissioner Law.
Thank you. You mentioned a couple of drugs that were in the $100,000 price range. Is there something generic available, and we chose to use a...
Yes, there is.
So somebody chose to use a brand name instead of...
They chose to use the newest and best, latest and greatest. People don't know, but Humira, which you see on TV all of the time, that's $8,000 a month. Okay? There are people using it for plaque psoriasis. It's an
There's
ugly
something
condition
else.
to have,
Yeah.
but is it worth $100,000 into the health system to deal with that? And I talk to your employees about these kinds of things. We really need them to help think, okay, the alternative, one of the drugs that's somewhere around the $90,000 range, the difference between it and the generic is you don't feel queasy for a half an hour after you take it. Okay?
Yeah.
So the fact that you guys let us talk to your employees, I think has had a huge impact. We don't see in your group, we have a couple of those drugs. In another group where they don't do this, they'll have 12 people. Okay? So, okay, it's only 12 people and it's only 20,000, well, that's $250,000. So, small things in large groups make a big difference. Another thing that's happened here that, didn't dawn on me until I started doing some of the other reports I have to provide, we've increased from approximately 82 to 99 on the health plan. We've added 17 people and still holding the budget. So this group has done just an excellent job at maintaining this thing. On the next page, we've talked about this before. You can see in 2011 when we started and where we're at in 2019, that's not much of an increase. We've had down years. If you set it against what we projected in actual, it is astounding how close those numbers are. I haven't gotten other counties to do this other than Misaki. But the thing that they all talk about is the fact that, wait a minute, your projected cost isn't going up. And your actual cost is almost on a straight line. So that's good. One of the things that we deal with here is the fact, and Jen and I have been talking about, budgeting processes and things. You have months where you're over and more months that you're under what we project as your budget. The interesting part to me is the fact that other than 1 month, we're really close now because we've got enough information that you're not having wild swings on what we're telling you anymore. The last one is kind of just the fun one. Where would you be if we maintained this plan? And what would it be costing? If you were in the pool, and we're getting a quote for you right now, next time I might come and do a little public comment thing for you or something, but you'd be at $4 million for that's what this type of plan would cost. So I told the employees, thank you for helping. I made them aware that we have a plan that doesn't exist anymore. It's still a $100 deductible. At some point in time, we may have to have a discussion about moving that. The big thing I told them was we still have something called a 1040 drug card. It's an open formulary. We do not restrict them in any way, shape, or form. Okay? Everybody else out there has at least 5 tiers. They have their $5 generic, their $10 generic, their $20 name brand, their $40 name brand, their 25%, 50%, 50%, okay? Basically what it does is puts more of the cost onto the employee. And I've told them that if we start seeing more of those drugs that cost high, we may have to consider, or I may have to bring for you to consider some changes there. And a couple of years ago, we had a little spike when nobody listened, and then all of a sudden, when they saw the numbers and we talked to them, it came right back down. So you guys have proven over time that costs are controllable with education. Last item is, you will notice there is no last page where we typically asked for a raise. We are not going to do that this year. Blue Cross has made some adjustments in the plan, and they're giving us a little money. So we're not going to ask you for any more this year.
That's good news.
Very good.
It's a sweet
Any
ending.
question, Commissioner Ansel?
You know, every year I bring this up, but, you know, we look at, you know, you provide information on projected versus actual. Whereas if we look at what our actual costs are, you know, we're looking at a 10% increase this year on our projected costs from what we actually charge.
Right.
So, you know, yeah, I understand our projected versus actual makes, you know, looks really good, but costs are still going up.
They're a little bit,
The
yes,
costs
they
are
are.
still going up. The cost that we pay is 10% increase this year. And I think that's just as important to know as, oh yeah, you know, we guessed pretty close, or we're below what we guessed.
Yeah, yeah. The one thing with the projected versus actual, we have to project because they have to fit, you guys have to
That's what
figure out a
insurance
budget.
is.
Yeah, you need a budget number. If I brought you the projected every year that I receive from Blue Cross Blue Shield, what you're talking about wouldn't be happening because they project much higher than I do. But I don't think that's fair to you because several things cascade from that. If I bring in too high of a projection, what Blue Cross wants to be able to do is come into you and say, oh, you know, you did a good job, we did a good job, blah, 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 we got this great big gap and everything else. But what happens is your illustrative rates go up, okay? And that's a problem. Your cap amount goes up. You guys right now don't need it, but you have the opportunity to say, holy smokes, everybody that's gonna hit 20,000 hit it in January. And we got a bill for $500,000. Now we know through the year it's gonna self-correct because we don't have those anymore, right? But if you needed to, you have a cap of $169 or $169,000, something like that for the month. You don't have to pay any more than that. So that thing goes way up if we use their numbers, okay? So I'm in a constant battle with them to protect the things you don't see. And so, yes, your costs are increasing a little bit, but like I said, we're dealing with at least 19 additional people.
Don't get me wrong, you know, I think you're doing a wonderful job, don't get me wrong, but,
Yeah.
you know, don't think that, you know, things aren't going up for
Yeah.
us too.
Yeah, yeah. Anything?
Commissioner
Yep.
Leonard?
Well, yes, we certainly do appreciate, Lou, everything that you do and you bring to our employees, and we definitely need to keep that up. As far as a $4 million plan is, what we understand and what our employees understand is we wouldn't have this plan if it were that much money.
They do understand that.
And that's why our employees do buy in. So
Yes.
we take care of them, they take care of us. So we're
Yeah.
really happy to provide this plan for them. But we do need to keep on this path.
Yeah, yeah, yeah. And that's one of the reasons, Mr. Ansler, is that, you know, every year I come in and talk to these guys about, you know, maybe we need to start, you know, that contingency fund to, if we get that jump that we didn't anticipate, you know, which is possible.
Any other questions? Thank you. No.
So
Thank you very much. Go ahead.
will we have a
Lou, don't you want them to approve your renewal today or not? Did you bring that, the new contract with Blue Cross, or is that next month you're coming back?
We've already dealt with
The
that.
board has to approve it, though.
I make a
Oh.
motion that
So
we,
just make a motion. We'll get the right
Yeah.
motions for next
for
week.
Tuesday night,
Okay,
right?
so we
So
move this forward to next
Tuesday
week.
night.
Yes.
To move approval of the insurance renewal.
Yes, please.
Is that okay? We
Yeah,
got a
that's a
second.
youth thing, not a me thing.
Okay, all those in favor?
Aye.
All those opposed? Motion passes 7-0. So we'll move you forward to next week. Thanks, Lou.
Thanks, guys.
Thank you.
All right, then that brings us to the Benzie Health District, Benzie Leelanau District Health Department, excuse me. First item is records digitization update.
Thank you for having us here today. Just to remind you, I'm Eric Johnston. I'm the Environmental Health Director for the Benzie Leelanau District Health Department. And I wanted to thank all of you for your unanimous approval of the Special Project Fund for digitization of our records back in your October 8th meeting, especially Commissioner Rettenbach and Commissioner Lautner for kind of spearheading that, so I really appreciate it. And the reason I say that, and I think you guys can all be proud, is that this effort is supported by business owners, realtors, special interest groups, the public. It is what I heard last time I was here that you wanted as well, and it is something we want. So as a commission, this is exactly what you're looking for, and I think you'll be pleased with it. So my purpose for being here today is to kind of give you an idea of where we're at this point in time. Let you know, let you have an opportunity to ask us questions. So after that meeting, we went forward to getting contractors to do the digitization and record management. Because there's two parts to this project. There is the screening or the scanning of all of our records, and that is nothing but a PDF format, so it's a picture of everything we have. It takes up a lot of space, it's a big amount of data. The second part is a records management program that takes that and lets us and the public and you take that information and make it available. So I want to kind of go through what we're doing with that. The first part was the scanning of the records. We went with DSS Equiture, which is a company out of Detroit area, and that saved us over $4,000 from Graphic Sciences, who initially we were thinking about going with. We found out about DSS Equiture right around late September, so that's why we didn't know about them back in October. But excellent company, they've been very good so far for us. They have collected our Leelanau County only files. They came up on November 14th, boxed everything up, loaded it on their trucks, and took it back to their secure facility. Since then, they have been processing and digitizing those records, and they have a projected end date of around February 20th for that. In the meantime, what happens is if we need a record, or the public needs a record, or anyone needs a record, we send them an email of those records that we need, or whoever needs, and within a few minutes, half hour, they send us those files digitally, and then we can forward those on by email. So we have access to those. When the project is completed, it's estimated that they're going to have 14,740 files scanned, which comes up to about roughly 208,000 pages of information. So on the records management or document management end of things, and this is the exciting part, we're going with a company called General Code that uses a program called Laserfiche. That kind of goes back to their beginning days when there was the microfiche, that black and white thing you saw at the library when you were studying and looking for papers. They still do that, but that's not their main effort anymore. They are a document management software company. And that the reason we're using it is because they allowed us to have the opportunity to have a public portal. So 24 hours a day, 7 days a week, if you want something, you can go onto our website, go through this portal, put in an address or a property number, and you can look up that record. So it bypasses our staff, which frees us up to do our daily activity. It allows pumper companies to look up as many records as they want, whenever they want, realtors, anyone. You can look up your neighbors, it's all public record, but you have that ability without having to wait for us to open at 8 in the morning or call us before 4:30. So, as I mentioned before, there's a lot of strong support amongst the community for this. All of our records will be stored in the cloud, so that large amount of data that we'd have to store on our small server is freed up, and it is up there. It provides security for that information. It also provides protection from natural disasters like fire and flood, because all of our records are, as you know, the originals, just like any other department. So now we have a backup in case something does happen. The files can be accessed. One of the nice benefits is that when we're out in the field, our sanitarians can now access those records as well. So if they went out and forgot to bring something, they can just go right in through the internet, get that information. They don't have to call, they don't have to wait. It's going to make that more efficient as well. Same thing for the public. It also allows, this program allows us in Benzie to help out somebody in Leelanau because we have access to those files. So the problem before is if you called and said, Vicky's out today, can you look up whatever record, I would have to call somebody and get it for you. That time lapse, we can do it right then and there, right on the phone. So we can have cross-jurisdictional support on that end of things for the people of Leelanau County.
Commissioner Rushing, you have a question?
I have a question for you. What type of information can we expect to find if we go to this public portal? What type of information specifically?
So anything and everything that we do for a particular file or a property is in a property file.
Okay,
so
examples?
All historical data, well logs, septic permits, anything that is not, anything that's public record is going to be on there.
So anything that's on the application when they applied or follow-up?
It's all public record. It's there
Okay.
right now. Yep. So obviously if we have information that's sensitive and that should not be out in public, this document management company their software allows us to extract information and to cover it up so that it obviously isn't out in the public realm if it shouldn't be. And that's something we would work with our attorneys on. So anything that's not FOIA-able is not going to be out there.
Do you have an IT director or something that?
We have no IT department. So that is myself and Mrs. Putney there. We are by proxy the IT department and have been for the last 23 years. So we do have people that we work with, obviously our contacts at these companies, they provide the support as well. That's the other thing with the cloud-based program is they have that support network for us if there's an issue.
We are only going to have basically pictures of what was in the hard copy file. And are we doing any optical character recognition so that we can run special reports to say, hey, pull me this, this, and this, or do I have to say, I know I want this property number? Or can I say, show me all the records you have for Carter Road?
Sure.
Is there going to be anything other than, are you going to get anything other than just pictures referenced by the property ID number?
Great question. Actually, I was going to touch on that, so thank you for bringing that up.
Sorry.
As part of that program, they do have optical character recognition software that we will be using to glean information off of any permits that are typed. OCR for short has a very difficult time reading any handwriting. So obviously the permits that were back in the 60s, 70s, and early 80s may be a little bit of difficulty on that end of things, but if they were typed at all, we can glean that information. So next week, we have training with Laserfish Company. They're going to come on site and do a 2-day training for our staff and us, and at that time, we're going to provide them with an idea of what we want to try to glean off of any permits. So obviously, age of septic systems, what type of septic systems, how big's the septic tank. Anything that we can get off of there that you may ask or want, or the general public may want. That is my ultimate goal. Unfortunately, we're a little handcuffed by the handwritten stuff, but...
You do what you can do.
Yeah, I'm going to do my best to get as much information as possible. So I believe strongly in data-driven decisions, and the more we can get, the better. So we have payments coming up on that program at the end of this month. January 30th is the date on that. And then for the scanning, it's 30 days after they deliver the product. And they figure about mid-February they're going to deliver that to us, and once we give approval for it, then we have 30 days. I hope to have everything done and available to the public and ready to go by mid-March. That is my goal. So that gives us time to, still during our little slow period, to kind of get familiar with it, make sure that we work out some bugs before we really rock and roll in April and May and June. So.
Commissioner Rush.
Do septic pumpers report to the health department when they provide service?
Not at this time, no. There is no requirement.
There's no requirement.
No.
Commissioner Wessel.
What was the number of files you referenced?
14,740.
Thank you.
Mm-hmm. And that is just well and septic property files. That's not foods or campgrounds or anything like that. We hope to update that as we go. That'll be something we'll do.
Thank you.
Mm-hmm.
Any other questions? Thank you very much.
Very nice.
So then we bring the early childhood partnership proposal.
Okay. I'm Lisa Peacock, the health officer for the Benzie Leelanau District Health Department, and also with me today is Dodie Putney, our Director of Administrative Services. I wondered if you have the draft proposal in your packet, or if you need... They have it. Okay, great. So I am pleased to be here today to present to you a draft proposal which defines a scope of work and proposes a budget for an interim agreement between the Benzie Leelanau District Health Department and Leelanau County that would cover a 6 to 12 month planning process for the development of a plan to implement the early childhood millage that was recently passed. So I think what I will do is just walk through the proposal as I did for the Board of Health in December. This draft proposal was approved to be moved forward to the county by the Board of Health in December. So the ultimate goal of this document and this stage that we're looking at is to develop a comprehensive implementation plan. The Benzie Leelanau District Health Department was indicated in the ballot language for the millage as an entity that might receive some of the funding to implement this project. And in discussions with Leelanau County Administration, our legal counsel, and our Board of Health, we determined that the best step at this point would be to have an interim step that would involve building the capacity within the health department to go forward with planning and developing the full implementation plan. It would be really important to us as a health department that that plan be very transparent with clear, measurable objectives for what would be accomplished with the funding that was provided by the millage to move forward in implementing early childhood expansion of early childhood services. So as we walk through the proposed document, I will just say that, previous funding for the work that is happening within this realm of early childhood and within the Parenting Communities program ended on December 31st. So that was another reason for considering an interim plan as we move forward. So the overview of the scope of work really is that we would establish an interim agreement that would allow for Benzie Leelanau to increase the staffing capacity to facilitate that planning process and development of a multi-year strategic implementation plan. As I said before, clear goals, objectives, and measures would be very important, but also to continue the ongoing parenting community services that have been serving the community for a number of years. So as you go through the scope of work, I then talk about background, and really this just talks about the early childhood millage, and the stakeholder group that developed the language for the ballot to be proposed to the voters indicated that they wanted to develop and implement through the millage a plan to provide all Leelanau County parents of children from birth to age 6 with a comprehensive framework of support that would maximize the health and well-being of both parents and young children. The overall intention of this project being to strengthen Leelanau County families, to assure that they have access to what they need to be strong and functioning, healthy families, which in the end will make Leelanau County a stronger and healthier place. So the program elements may include parenting information, opportunities for support and networking with other parents, individual and group visits to provide parenting education and support, information assistance with access to preventative physical and dental health care, referral for or direct provision of behavioral health services for families, and parent-centered community events where parents can network and be connected to services and find the support that they find in interacting with each other. So an overview of the project is that we would establish some initial staffing at Benzie Leelanau Health Department. There's several staff roles that I describe within the document. But the staff roles would all be aimed at achieving these objectives. So there would be 5 main objectives that would hope to be accomplished during the interim period. The first one, like I said, would be to evaluate and oversee the current parenting community staff, the programming that is happening, the existing staff that are doing that. That hasn't been it's been contracted, the health department has been contracted to provide some of those services over the years. So we provide some of the programming, but we don't oversee the direct services. So one of the initial objectives would be to pull those services under the health department so that it's receiving the same health department oversight as all of our other programs. The second objective would be to develop policies and procedures as well as a documentation system for this expanded programming, looking at the program itself and the existing elements that have been working in Leelanau County for all these years, just making sure that it falls within the framework of the health department so that there's guidance, policies, and procedures that would be guiding that work. Another important objective would be establishing a community advisory committee, which would assure community input. This millage was passed by the voters. It's important that the funding be used for the reasons that it was intended and that it would accomplish the goals that were considered and presented by that stakeholder group to the community. And so a community advisory committee is important to assure as this program is being developed that there's community input provided. And then another important objective is summarizing what data is available currently. Some of that was done by the stakeholder group in terms of what are the needs of the early childhood population across the community. But what else needs to be determined, and what are we going to use as metrics to measure our progress toward the goals of the program? And then the ultimate goal, as I stated earlier, would be to develop a strategic implementation plan that's transparent and clear and agreed upon between the Leelanau County Board of Commissioners, the Board of Health, and the administration of both the Health Department and Leelanau County. And so staffing would consist of a variety of roles during this interim period. We would need to add a couple of staff to be able to increase our capacity. And again, like I said before, we'd like to maintain the staff that are currently providing the services to the community. So the first one that is described is an early childhood program coordinator at a half-time FTE. And that role would be charged with leading the development of the implementation plan. This would be the person who really would be pulling all the pieces together, assessing the current strengths and weaknesses within the community and of the current programming, gathering that community and stakeholder input, and then developing a detailed scope of programming and working on the nuts and bolts of what would become, hopefully, the implementation plan. We've included a supervisor in the staffing plan at a half-time FTE. This could be the same person, a coordinator and a supervisor, could be one full-time person or 2 half-time people. It just depends. We do that different ways at times. It depends on their skills and experience and the program activities that they're trying to achieve. But the program supervisor basically oversees the current services and staff. So since there wouldn't necessarily be the structure of parenting communities as it has been, that's where the oversight and supervision has been in the past. That would need to be moved to the health department, and we would need to build the capacity to provide that supervision. This would be the person who would be assuring that job descriptions were clear and reflected the work that was going to be carried out. This would be the person that would be working on hiring new staff, supervising the current staff, and monitoring the progress toward achieving the goals of the project, and as well as the spending of the dollars. There's then a couple of different roles related to a social worker and community health workers. These are important roles, as these are the roles that are currently providing services to the community through parenting communities. As I said, the current funding for that program ended on December 31st, so we're kind of in a holding pattern. We have one staff person from the health department who has been contracted to provide some of those services, and we had some internal shifting of a vacancy that we're not filling, just sort of waiting to see what happens before we replace that position. So that those roles, the MSW and the community health workers, would continue to provide services, and those would be things like play groups, individual and group visits, outreach, some of the work that they have been doing. And then we included some time for the Leelanau Health Department administration, both some of the Director of Administrative Services and the Director of Personal Health Services, to provide overall agency oversight, monitoring the budget, communicating with the Board of Health and the Leelanau County Board of Commissioners, and providing the quality assurance activities as we do for all of our programs. And then finally, we just included, as we do in many of our proposals, a method of accountability, that this project would be accountable to both the Board of Health and the Leelanau County Commission, and that we included the budget. So all of our budget categories are budgeted according to standard categories that we use for all of our programming. So I'm happy to answer any questions about those items. But I just wanted to mention a couple of things about the health department and our history in providing services such as this. We just recently received some evaluation data from one of our other programs, which is similar. We provide lots of different home visiting programs, and they're funded by different sources, and I think that's one of our strengths, is that we are funded by multiple state, federal, local, grant-funded funding sources, and we have to be accountable to all of them. So we pride ourselves on being transparent and clear and doing things according to the guidelines that we've been given for carrying out a program. And just, we are participating in a pretty rigorous evaluation of our Community Connections program, which involves nurses, social workers, and community health workers as home visitors to help people get connected to resources that they receive to meet their needs around the social determinants of health, things like housing, transportation, basic needs of living that can get in the way of being healthy, get in the way of achieving good health or getting the healthcare resources that you need. And I just got these numbers yesterday, so it's not a formal presentation, but over 92% of our clients in that program reported that Community Connections helped them to get connected to resources that they couldn't get before. And so it's a complicated system out there. It's a complicated network of resources that people sometimes aren't able to access. Beyond that, 96% of our clients in that program said that after working with our workers in that program, that they are more able to support their own health. And that's always our ultimate goal, is that people don't need us. We want them to be able to function independently. We want them to be able to achieve good health for themselves and their families. And so we're very happy when our programs say nearly 100% of the people we served are better able to help themselves. And then nearly 90% said they understand more about how to get what they need, and 3/4 of them reported that they are not only able but confident that in the future they will be able to get what they need. And I'll just share a quote from one of the client, anonymous quote, about one of our workers in the Leelanau Health Department program. She said, "She was just a lifesaver. I thought all hope was gone. I didn't think there were any resources left, but she found all kinds of them. She went above and beyond the call of duty." And there were multiple comments like that in this evaluation. So I think I'll stop there and ask if you have questions.
Any questions? Commissioner Walker.
What again is the indirect costs at $100,000?
Indirect costs are the costs that aren't charged specifically to a program. They're not necessarily a program element. So they're the backbone costs like accounts payable, data lines, phone lines, human resources, those kind of costs. And what we do with those costs is we spread them across our programs according to the amount of FTE in the program. So
those are already employees of the health department, so now they'll be doing this work, and so the employees of the health department now will be getting that $100,000.
it's based on the FTE in the proposal, so the
Yep.
staff according to that program.
We try and charge every single expense to a program. And those dollars that we can't is general administration. And it's, like Lisa said, the space, the technology, finance. They're spread out to all the programs.
Any other questions, Commissioner Rettbach?
I would make a recommendation to the Board of Commissioners to approve the Leelanau Early Childhood Village Planning and Development proposal as presented.
Where, then the funding to come from where?
It's documented in the document.
All right. We don't have the sales
I'm
for.
raising my hand, or you're
Yes.
not recognizing.
Well, I'm waiting for, okay, go ahead.
I
But
will
I don't want
second
to.
that motion.
Oh, well, yeah, you just, see, we have to have a second before we're comment on it. So if you just second, anybody would just second, and then you don't have to raise your hand, because then it could be comments. That's what the way I take it. Yes.
So, this is the document that was approved by the Board of Health, and it is extremely comprehensive, and I have every degree of faith that I can have that it will be carried out in a very professional and timely manner. And that's what I'm basing the recommendation on.
Commissioner Ansari.
I do have a request or a suggestion here. Under the accountability, we're going to have some feedback, coming back to this board. I'd like something like at least quarterly, something like that, to say how often are we going to get that feedback. I'm not saying we have to do it every month, but I would like to have, something at least quarterly, if that could be amended to say, I'm just asking you, is that reasonable to have that put in there to say, you're going to have some feedback, we're going to have it in this time frame?
Absolutely.
So, is quarterly
Quarterly is very
acceptable?
reasonable, yep.
Okay.
It's very
So-
typical for reporting on our other programs as well.
Yeah, if we're gonna have them, starting this implementation, I'd like to have some feedback on a regular basis. And, if quarterly's, I'm not sure monthly is good because the health board only meets every other month, but if quarterly is acceptable, I would like to have some feedback on a regular basis. So I would suggest that amendment to this document.
Okay.
Is there a second on that?
I'll second it.
All right. So, I guess I'm a little nervous that we're going so fast with this, again. I've actually contacted Catholic Human Services to ask them to give us a request on this too, so that we would, so I'm thinking that we haven't sent this out for RFP. We don't have a contract of any kind, and I know I contacted Grand Rapids, and they said that they only had one proposal, and that they had no others. And so that's why I thought we need to talk to some other people, that we don't just get one proposal. I know I talked to the Bonic Agency, and they came, and I believe that saved us $10,000 right there. So there's nothing to compare this to if we go ahead with this. So I'm thinking that we're moving a little too fast to get this. And plus, the millage doesn't even come in till next December. So I guess, are we going to loan them the money till December and then pay it back, and then every year loan them again? Because we haven't talked about the funding, which maybe should have put that beforehand. So I think we've got this a little bit, the cart before the horse here. Commissioner Walker.
Yes, thank you. Who do you have plugged into the positions now that you would keep on, as you said, you would keep present staff? Program coordinator,
Who?
The program coordinator is not a position that we currently have staffed.
Okay.
We currently have, our social worker is currently
Do you
working
have
in
a
the
program supervisor?
We have a program, we have supervisors, but we would add supervision time for this, so.
And who is that?
Our current supervisor is Debbie Aldridge. She wouldn't have enough time to take on this program as well. We would need to add supervision time.
Okay. And you said you have a social worker?
Yes.
Now? Who is that?
Amanda Stowe.
Okay. All right, and do you have a community health worker now?
There are 2 community health workers who work within the Parenting Communities program.
And who are they?
Kathy Bartel and
Holly Anderson.
Holly Anderson.
Holly Anderson, did you say?
Those are not currently health department employees.
Okay, but you're thinking of keeping them on?
Right.
Personal health director?
It's Michelle Klein.
Michelle Klein? Okay. And Director of Administrative Services?
Dodie.
Jody. Okay. I agree with the comment made by Will that we are pushing this through too fast. I found it interesting that this train hit this track and hasn't even slowed down. We need to, as far as to be accountable, we need to take this and put it out for RFP and make sure there are no other agencies interested in any part of this who can do it for perhaps a better price, maybe provide better service, maybe the resources are better. I'm very concerned that we would just hand this over to the health department when it was pushed so heavily by some of these very employees. And they were telling the public that it would be the health department running this program. So it got past our voters in that special election we talked so much about, with this assumption that it would be done by the health department. That was a train somebody mentioned last month that it got on track and it's running fast, and it's unbelievable that we would just come here in January and say, okay, yeah, we're just going to hand it over to the health department to handle, without any kind of idea of anything. My concern, and I expressed it and was outvoted at the health department, is that these would be employees of the health department. The health department should be doing these employees contractually so that when the funding is no longer there, the health department isn't going to be stuck with full-time employees, because they won't be able to be kept through attrition. They're not going to fit. So I will not support the motion to just hand this over to the health department, certainly not in January. I think there's more work to be done. I think it needs to be studied more. And I'm very disturbed by the whole entire process.
I find it utterly amazing that on one issue, this board is in a race for the final decision. On another issue, it's like, whoa, wait a minute, we got to study this, we got to get all the facts, we have to check to see who's going to do the best job, in referring to the airport governance model and this. The least we should be doing is developing an RFP and sending it out for bids. There's nonprofits out there, as has been stated, part of this programming may be better served with a different agency. And I'm not criticizing the health department. They may, in the end, be the best fit for us. But we haven't even allowed that process to go forward. And I get really confused about, what's good for the goose is not good for the gander with this board. So I would support the RFPs to see what is available to serve our citizens in this capacity. I also will not be supporting this today.
I do think we need to look at funding before we go ahead with any kind of.
Another big issue.
Yes. Because we have the options on here, I think they got.
I don't disagree with that. I don't necessarily want to piecemeal this. I do want to hear this discussion about how we're going to fund this, whatever it is. But I also have to recognize that this is a 1-year process that they are proposing for us to develop this. I'm not sure, basically, they're going out and came up with a process to put this into place and identify some of that information, that very information that you're asking for, that we may have, in a subsequent year. So I don't necessarily want to force this process without having this discussion, and I don't know what's the process we can do to have that. I'm asking this from a procedural standpoint.
I believe we can discuss the options for funding it with this motion. I don't think it has to go according to that, how it's on the agenda. We can actually bring up, and ask Michelle to give us how this could be funded.
Yeah, I do want to have that discussion, and it does have a bearing on this decision. So, procedurally, I would like to do that, however we can do that.
Okay.
I think on the funding, we're just gonna give you options. We weren't asking you to vote on anything today. We thought, as you were saying, you need to know what the funding options are. So I don't think there's any conflict.
Okay.
So I think Michelle's ready, and just as background, obviously this is a brand new program for the county. Michelle and I have not gone through this, so we have spent a substantial amount of time talking to legal counsel as well as our CPA to make sure we're following the right process, because it is complicated. And I think based on the motion, I assume the motion is for us to develop a contract, because we have to have a contract in place first. But you want to talk about the finances now, or do you have, I see questions on that?
Yeah, well, I wanted Commissioner Sudas Little to
Oh,
speak.
okay.
She had her hand. Yeah, go ahead.
Just a couple of things. One, as the health department just iterated today, as Lisa did on behalf of the health department has a tremendous track record in these type of programs or components of this program. And they have a real track record for clear, measurable objectives on anything that they do. So from my standpoint, given, and I should say too, that this was recognized by the Early Childhood County Committee, of which only 11 of those members, including people who participated from the health department, were health department employees. The rest were all individuals with expertise in early childhood. They were businesses, they were churches, they were program providers. We had all manner of individuals with any type of concern that participated in this, and they all felt that the health department would be a logical choice, because this is something, early childhood programs of this nature have been going on for 20 years. So it is not quick for those who've been working in the field, and certainly for the families who've been looking for the services. I don't know why we would go out and look at other organizations when we have the health department, a member of our county with expertise here, who not only could do the job, but has been doing the job for the past year with different elements of this program. So I find it difficult to waste time, and I will put it that way. Ordinarily, there's always legitimate reasons to look at RFPs, but in this particular case, it's no different than what we've done many times in the past. And that is to go with the logical, apparent organization that can do the job. Also, just to let you know, Maria Alvarez is the person who, at Kent County, is administering the program, and I personally talked with her on a number of occasions, and she's been a tremendous advisor over the last few years as they were bringing up their program. And they have had a number of contracts that they've let. Like our county, they are constrained in terms of what they can do for services for families. But they are very happy with the first round of funding. They did have multiple people apply. I'm not sure who gave you the information you received. And they are implementing contracts, and now they're in the second phase. Now they're serving a different population, a larger population. And I'll also say there was a split decision on their board when they approved the millage. It was split. So the comparison between our two counties in terms of how we function is no different, but I think we move forward, waiting to 2021 or 2022, that's 2 years of a child's life, and it means that there's no services for those families for those 2 years that are relying on these services. So for all of those reasons, I hope we move forward here.
Commissioner Redpath.
Well, I just would like to draw your attention to the very first line that is in the proposal, that made a motion about year one, Leelanau County Early Childhood Millage Planning and Development Interim Agreement. So it's not to say that it couldn't go out for RFPs in the future. But we are partnering with the health department. It was mentioned in the millage proposal that was approved by the voters in this county. And just encouraging that we move ahead, and I guess I'd like to call a question.
Commissioner Wilson.
Well, I was raising my hand. Do we need a second to that, calling the question?
Yes.
I second that.
So we're not going to discuss the options of the money or anything. We're just going to go forward with this because she's called. Okay, so I mean that's what's going to happen if it ends discussion here. This passes. Everybody understands? So all those, yes.
I don't think that's the case at all. We are going to talk about the funding. We are going to talk about those possibilities, but that's not related to whether or not.
If the motion,
We
if the
can't-
motion
yeah,
is
it's called
supported
question.
on
We can't
the
discuss
table,
it.
we have to vote on whether it's called to
The
question.
chair stated something that's not true. We are going to talk about the funding.
Before the vote on
That's correct.
on that.
That's correct.
That's not the way it was on the agenda. I'm going to
Right,
vote on the
exactly.
agenda.
So I am correct, even though Commissioner Wessel disagrees with me. Okay, this is for calling the question. All those in favor?
Aye.
All those opposed?
Aye.
So the motion fails. So we can discuss the options about the money and other things. Yes, Commissioner Wessel.
I don't know why we would go outside of our county to find a nonprofit when we have 3 members of our county on the board of the Department of Benzie Leelanau Health Department. 2 of them are county commissioners. I'm concerned about accountability, and what better way to have accountability than have one of our proven partners with representation from this commission on that board reporting to us on a regular basis. I feel strongly that accountability is an issue, and this is the best way to ensure accountability.
Commissioner Lautner.
Yes, thank you. Well, I have a lot to say on that issue, and I guess I will start with that, which was my concerns with this whole thing from the very beginning. And from the very beginning, a lot of discussion was not even covered at this table. Because of the freight train, this program got on and headed down the rails, such as calling the question before we've even discussed this in any great detail today. So this started out so innocently just with this little committee studying this, right? And so you talk about the health department. Health department sends one person to attend these meetings, and so the director of our health department isn't on board and isn't even aware of a lot of what was being said and what was going on and what was happening when it hit this table, and yet it passed this table. So that's my concern. Ms. Peacock has several counties or health departments, So we have the head of our health, running our health department, and the head of our environmental health, most of the time doing the day-to-day work. So there was a whole lot of unknowns before it even hit this table for a vote, but yet we weren't concerned about that. So now we're going to say, let's just hand this over here in January to the health department with this one proposal. So I do have a lot of concerns. There's stuff that I brought to the health department table in the past couple of years and nothing happened with it. So whether, you know, now the health department's just going to take off with just this issue. And this is more than a trial. So what you're saying is that we're going to hire these employees on a trial basis for 1 year and then put it out for RFPs? Because if you hire these employees, I guarantee you don't plan on putting it out for RFPs. So otherwise you're going to leave the health department hanging with employees, which has been my concern from the very start, because if they do not contract these employees, they will be health department employees that Leelanau County is 50% responsible for. So another thing I'd like to know, and I've heard it several times now, in the statements been made, that the majority of our children population is up in the townships that passed this millage request. And I would like to know where those numbers are coming from, because I can't believe that Elmwood Township doesn't have the majority of children in our county. We have all of Timberlake. Solon has all of Partridge Run. I mean, there's a lot of big developments in those areas, and I know there's a lot of children. But the point is, Traverse City Area Public Schools was left out of this whole thing. There's nothing in here for the children on the south and southeastern portion of the counties, unless, of course, they're going to want to drive way south to take advantage of any of these programs, except for those who the programs where they will come into your homes. But I haven't seen any anything that says that there's anything being done in the Traverse City Area Public Schools for our children down there. So that is one answer I would like to get. I'd like to know those statistics or where they're pulling that from, because it is my true belief that, as was this whole thing, we left out all of our children that attend Traverse City's public schools, shut the door on them, and now we're just going to pay attention to those counties in the north end of our county and west end of our county. I'm greatly disturbed by it. This is being rushed through way too fast. I think the least we can do is put it out there for RFPs and see if there are any other agencies. I know we've got some great agencies in the county, and if they could see what is here, see what they could potentially handle for us, that's the least that we can do for our taxpayers, of which my district said no. Thank you.
Mr. Rush.
Our voters did vote to put this in place by 99. They also voted for their taxes to be collected throughout this year. That didn't mean that we would implement the program in January of 2020. It meant that we would collect the money in 2020. This gives us an opportunity to see what options are available to us, what other programming is available to us. In the end, it may be our health department, but we're not even opening that door to see what our options are.
Commissioner Ansel.
I would like to hear the discussion about funding. If we can work that in somehow. I don't know procedurally how you do that.
No, I mean, we just asked Michelle, do you want to give us about the funding, or would it be better check?
Well, I think we're both going to do it.
Okay.
We both had. We spent a lot of time last week on this, because, as I said, this is a new process for us, too. The ballot language did say 5-year period from 20 to 24.
2020 to 2024, which means it'll be on the tax rolls for the first time December of 2020, this December. So the majority of them funds will come in. The deadline for paying those taxes is February 15th of 2021. So the vast majority of those funds will come in during 2021. So that's, just want to clarify that. That was part of the ballot proposal. And the question is, how do you wish to go forward if you wish to start something this year? Is it legally possible? And then how do we fund it legally so we don't have auditing issues? So the majority of our time actually was spent with our CPA firm last week, one day, getting that clarified, because we knew that would be a big issue with all of you. We want to make sure that A, all of you knew the options, and B, that we run solid accounting practices so we would not be surprised during an audit for the following year. So Michelle and I and Jen spent significant time with our CPA, and then we also talked to Mr. Stoker to make sure that both were saying the same thing, because this is very complicated things. So the tax money will be collected for the first time December of 2020 through February of 2021. Unless some people pay late, then there's a fee. But majority will come in 2021. If you wish to start a program in 2020, that's your choice, and Michelle can explain how the financing would work. Obviously, one option is, as you stated, start 2021 once the funding comes in. You do have an option if you wish to start it this year, and Michelle can explain that.
Is it okay to speak from here? Do you want me at the table?
Right,
It's okay.
that's fine.
You've got a few options. Like the administrator said, you can wait till 2021 to start. You can choose to start now. There's nothing legally that says that you can't start now. You can also fund it yourself. It would not be anticipated that this is going to swing into full cost immediately. It's not. It just isn't really possible with all the contracts and all the work that needs to be done. So you could just pay for it. You can also advance the funds to do this, and what we would do is capture those back as soon as the tax money started to come in. So if we needed $300,000, let's just say, to get the program up and running in April, May, or June, whatever month, we could advance those funds, and then as soon as those tax dollars start to come in December, January, we would recapture that money back to us. It is not a loan, it's just simply an advancement of funds. With the understanding, let's just say that this millage proposal is just once for 5 times. Not getting into whether it will go on or it won't go on, but let's just say it's one time. Your last tax collection, if you start advancing, depending on when it would take to get to the potential full exposure of what was asked for in the millage, you know, it could be that 5 years that your program might end in December of 2024, and you may have to capture an advancement on that bill that goes out in December of 2024 for some of that advancement. It just is going to depend at what level and how you're creating the program, at what speed, as to how that revenue is going to balance. But it could be that you advance some this year, you know, $300,000 or $400,000. I would never be in the position, nor would I think the administrator to be, that we would want to advance the full potential of this millage. Well, you're not even there, we're already in January. That would have to be another conversation just because of the amount of money, because I think it was the millage was up to about just under 800,000, 728,000. That would take another conversation. So you can advance the funds, but it would be incrementally and it would not be in that full 100%.
And just one more piece, just so you all understand, there is no money set aside in the 2020 budget for this program. If you wish to fund it, it has to be general fund dollars that you would have to allocate, would come from your contingency fund. The money would not be reimbursed in 2020 because of the way the tax rules are. So can you do it? Yes, but it would have to be an advancement from your general fund dollars that would be paid back, but not during the 2020 year. So as If you choose to do it this year, it will be general fund dollars.
And contracts would have to be in place
Yeah,
to
contracts would
allow
have
for
to
the
be in
release of
place.
that. We're not going to just start releasing advancement of funds without contracts in place to justify the dollars that we would be advancing.
Commissioner Hanson.
Is, I don't know who you talk to, but is this unusual? Is this a normal business practice for counties to do this, or, it is?
I would say it's not common practice.
Okay.
Can it be done? Has it been done?
It's
But
legal.
not. Pardon me?
It's legal.
It's legal, it's not common.
Okay.
Most of the time, obviously, from a strictly accounting standpoint, you collect, it's like senior services. You collect the money that year, you spend it that year. This would be a unique set of circumstances, yes.
And it has to do with cash flow, quite frankly.
I understand.
That's why other counties can't talk about it.
Commissioner Wesson.
We don't have a contract, though. We are talking about voting on whether we want the health department to begin work on a scope of work and a contract, which would go to our attorney.
I would say, we always ask our attorney to draw up the contract. I just want to clarify, in your motion, you were assuming that we would draw up a contract, then it'd go back to the board for the board to approve and review. But we would draw up the contract.
The point I want to make is we are just asking for a motion to proceed with the health department working on the scope of work. Correct?
An interim agreement.
Well, if we advance the money, let's just say it's $375,000, then next year, 2021, when that comes in, they have to pay back the $375,000. But then we would have to loan it to them again.
You would be looking at you would be looking at how much is collected and what programs you have established and what those contract dollar amounts are to know how much is being offset by what has been collected versus what may there be short pending the next.
Always in
Right.
arrears.
Yeah. So let's just say it's $800,000 just for number purposes. And this year, the board chooses to allocate $400,000 to advance that money. So when the money comes in 2021, of that 800,000 comes in, 400,000 would be used to pay back. So for 2021, you'd have 400,000. So you would either have to limit the program to that much or do another advance. Because it has to balance, because you have to pay back the advancement. I don't want to say a loan, because it's not a loan. Because it's an internal accounting thing. But the other option is, if you choose to only spend $600,000 of the $800,000, every year there would be a $200 amount that would use to pay back the loan. So really it's up to you how many contracts, how you allocate those funds. But yes, if you spend, whatever you spend in this year would come out of the 2021 allocation, and therefore that amount would reduce either in services or another loan for the following year.
No, it's not a loan.
I'm sorry, take that out.
Sorry.
Another advancement, an internal transfer. How's that? Is that a better word?
So who did you talk to at Raymond Robson?
Paul
Motz.
Mertz, is that?
Paul Motz.
Motz.
Max?
I did speak with a lawyer about this, and he said the simplest, easiest way is just go with what the millage says. Get the money when you get it and spend it on it. Otherwise, it just gets, accounting gets complicated, and the county advancing gets trouble. So he said the simplest, easiest is stick with what the millage, what the people voted on. Don't try to push something in different than what the people voted. Yes. Commissioner Ansel.
People did vote for this service to be offered and provided.
Not this year.
The question is, do we wait a year to implement the wish of the voters? I understand there's some extra hoops accounting-wise that we would be jumping through. There's also a cost of not starting those services this year. And that cost is to the people that were gonna get those services and won't get them this year. So there is a balance here. Which way do you want to go?
Commissioner Lautner.
Yes, thank you. As you said, as it sits today, that this did pass by a slim margin in this special election. And per an answer to something that was stated this morning, I still have people approaching me and asking me what this is all about. For one reason or another, whether they, for one reason or another, didn't realize what was on the ballot last year, or even if there was an election, which is why, obviously, it was done in this way, in a special election. So I had asked that question, and the question is, why didn't you just put it on this fall with the general election? I said, well, I think you know the reason why. So I had asked the question of, because I had been asked to find out whether if by petition, the citizens of the county can petition this to be on the ballot this fall, and I have not gotten an answer to that. So we need,
Petition, I'm sorry,
whether or not the people in this county can petition to re-vote on this fall. That is the question.
No, it's passed for the next 5 years.
That's what I was told.
Yeah, there is no
Okay.
revote option.
No, even to petition for a reconsideration by the voters of the people. Okay. And did we get that in writing?
No, could if you want.
Okay. Yes, I think that would be helpful.
Just
I can address a little bit of the question Commissioner Lautner is asking, and I believe what Sue Miller said in her comment was that 6 of the 7 townships, and there are 11 townships, but 6 of the 7 townships passed by a comfortable margin, and that in the 7th, which was Elmwood Township, that it lost in Elmwood 1 by 6 votes and in Elmwood 2 by 2 votes. And that is a heavy child area. You're correct about that, Commissioner Lautner. The numbers, I'm assuming, is the same numbers that I've seen, which is she probably looked at the results from the election. And in doing so, you can see who voted yes, who voted no.
This wasn't my question.
Oh, well, sorry about that. I thought that's
Okay.
what you were asking. So anyway, that was my only thing I wanted to clarify.
Commissioner Answer.
I'm gonna make a motion.
We already have a motion and an amendment on the floor.
Okay.
So, and I can't remember what your amendment was to it. We have to vote on that first.
The amendment was to add quarterly,
Oh, yeah.
the term quarterly reporting, so that we just have feedback. We know when we're gonna get feedback.
All right. So I'll ask for that. We'll vote on that at this time, unless there's any more statements. For his amendment to add for quarterly reports. All those in favor?
Aye.
All those opposed?
Aye.
So the motion passes 5-2. Okay, then the second, then that would be added to the first motion by Commissioner Rettenbach in order to move this forward to next week.
May I have that read back to me, please?
It'll take just a second.
That's okay.
I just want to make sure
Yeah, no, that's
I
good.
understand what I'm voting on.
I think we all should, that'd be good.
Am I allowed to talk
Well,
at this point? Okay.
Recommendation to approve the Leelanau early childhood proposal as presented, seconded by Ansel.
We do need a contract for that, I believe.
And that's going to be my,
Yeah.
I would, we got to have something in
You
there.
can amend the motion to include that.
We can add a second amendment to it. Commissioner Rettenbach?
Okay,
Or
Go ahead.
go ahead.
I mean, we're allowed up to 2 amendments.
I would amend the motion to read, I move to recommend that the Board of Commissioners authorize the county administrator to negotiate and prepare the final contract for the early childhood millage planning and development proposal with the Benzie Leelanau District Health Department and respective legal counsels for consideration of approval at the January 21st, 2020 regular Leelanau County Board of Directors.
That's a whole nother motion.
Yeah, I don't think it can be done
Okay.
by the 20th.
Well, just one, you're just recommending, so
Yep.
you have to vote next week to even authorize the development of a contract. So a contract, it can't be done on the 21st. You're just recommending today, so that motion will have to pass next Tuesday.
Go ahead.
Somebody
Have
can
you-
withdraw that motion. I'm so
transferred,
sorry.
yes.
Have you been in discussions with our council and the district health department on this topic?
On this topic, but not about the contract.
Not about the contract?
Because we haven't approved a proposal. So the clerk and I and Jen have a discussion about the legal aspects of what can be done, what cannot be done. We have not had any discussion because the proposal was first passed by the health department board, and then your board has to endorse it before we could have a dialogue about a contract. So we've talked about the concept. Can they draw a contract? Yes, and Mr. Silver's saying there has to be a scope of work, there has to be a dollar amount, but we have not had discussion about the specific contract.
I'm just trying to understand the process.
So if you pass it on to next Tuesday, then if it's approved Tuesday, then we'll have dialogue, I assume a conference call with Mrs. Peacock, your attorney, our attorney, to draw up the contract.
Commissioner Rush.
The gymnastics that we go through to try to get our own way. It's an uncommon practice, but throw that out the window, move forward. RFPs, not necessary. The people did vote. They voted to have their taxes collected in 2020 for the program to be implemented. Okay, now, what do we have to do? We have to take money out of our funds to begin this process. Sheriff came to us for a boat. What did we say about that? We got things coming up in our future. Did the people vote for us to take the money out of our accounts and put it over here without even considering some of the infrastructure that may happen? Have we looked at that? Have we looked what our plan is? I forgot what the name of it was.
CIP?
Huh.
No, I'm sorry, not CIP.
Capital improvement.
Thank you. Our capital improvement plan. Did we look to see how this decision would affect those things going forward? No, because we're on the fast track. We got to decide that right now. No, we don't.
All right, so the, I mean, the motion is, I mean, we didn't amend it, did we? So it's going to stay the same as what she read? But we'll just move it forward till next week?
You did have that one amendment. With
The one amendment's already passed, and
That's
it's
passed,
quarterly.
it's
Yes,
added.
that's added to it. So Commissioner Rettenbach's motion is what we're passing, or I mean, what we're voting on.
As
Forward
amended.
as
It's
amended.
not to move it forward.
Yes.
It will move it forward, but it's
Yeah.
not to move it forward.
Okay, I'm
All
confused
right.
again.
Yeah.
Tell me,
Read the motion.
You want to read it again, please, Laurel? I'm sorry. Commissioner Rettenbach.
recommendation to approve the Leelanau early childhood proposal as presented. That was her original motion.
Okay, and then we've added the quarterly reports. So, all those in favor?
Aye.
All those opposed?
Aye.
Motion passes 4-3. So, okay, so then, I think now we can take, I think we've discussed the early childhood funding options, or do you want to go through that, Commissioner Wesson?
One of the reasons we're struggling with this, I think, is we're not working together. And we've had individual commissioners go to seek legal opinion unauthorized by the board. We've had individual commissioners talk to service providers about submitting RFPs. And I think part of what we need to do is start acting as if this is the will of the people. We've made a decision. Let's move forward and do it right. And I think that means that we can't, as individual commissioners, seek legal opinion without going through our administrator, or seek bids without going through our process. And I think that's very important. And I've waited until we made that decision to make that, but I did communicate with the chairman in writing earlier, because I am concerned that that's not good practice to act as individuals when we're a part of a commission. We have an administrator, we have a clerk, and we have action by the commission. And I think it's important that we follow that. Thank you.
Commissioner Wren.
Our health officer from the board asked to speak earlier, and she was denied that opportunity at that time. I would like to hear what she has to say.
We'll give her a chance, yes. That'll be, but we have commissioners who are speaking right now. Commissioner Lautner.
Yes, thank you. If, Mr. Wessel, that you are implying that I went on my own to legal counsel, I did not. So if there's another commissioner did, they can explain themselves. Okay? Just clear that up. Interestingly enough, when we say that we should all work together, I find that very interesting when I go to a health board meeting and hear from the health officer that she's already been in conversations with Leelanau County about all of this, when it hadn't been to this table. Nothing was mentioned at this table in November. I found that curious, and I thought, I wonder if it's all being done behind closed doors. Huh. I go to December meeting and find out, guess what? We've already been in discussion with commissioners and our administrator to do all of this. This was placed in front of us in December. So I don't think anybody can stand up here and lecture anybody else on working together.
Commissioner West.
Commissioner Wessel eloquently made a statement that I've been making for months now. We've had policies, we've had procedures, we have got precedents, and every time this board has violated that.
Any other comments? Please.
Okay, I just wanted to comment on two things. One is the purpose of the interim agreement, and I just wanted to say that the purpose of an interim agreement from our perspective was to be able to do a really good job with developing an appropriate, comprehensive implementation plan to carry out the millage as it was intended, and do the best job that we could with it. It was not at all because we didn't think we would be able to accomplish that, or that we didn't think that in the end we would be chosen to accomplish that. We are not just another partner. We are your health department. As you know, as a county, you are mandated to provide public health services, and our health department is organized as a district health department under the Public Health Code to do that for Leelanau County. And so we're not another partner, and I will confidently say to you that I believe wholeheartedly in our ability to do this. As to our involvement ahead of time in the planning process and the work group, we assigned our Director of Personal Health Services to be part of that work group as a content matter expert, and that was appropriate. I stand behind that decision 100%. She is the person who is most directly involved in overseeing these types of services in our health department, knows the most about it, and that is why I feel that this proposal for an interim agreement is very feasible and very realistic. It's estimated at a 6 to 12 month level. It could be less, it won't be more. It was important to us to estimate on the higher end so that we could do what we said we could do. And so I believe that it is feasible and realistic because of her involvement in the planning process. So I believe that that was important. Any other, I guess, perception that we were or were not appropriately involved was probably due to my concern that our health department not be, especially myself, involved with influencing the voters. A content matter expert is something else completely. And so if it seemed that I was not involved, that's purposeful because they were working, that was an appropriate person that I would assign to be involved in any kind of planning for early childhood services in either of our counties would be Michelle. So, I want you to know that I feel very confident about the health department's ability to perform this. I feel that we are a part of the county. And some of the reasons that I feel that that there would be a benefit to the people of Leelanau County and to you as the administrator of these funds is that we have established relationships with most of the early childhood partners in the community already. For years, we've been working with Great Start, Early Head Start, the Grand Traverse Band, pediatricians, primary care providers, across all of those boundaries and service areas. There's very few new relationships that would need to be built. The health department staff already have broad knowledge and experience that they could bring to a project such as this. We have nurses, social workers, dietitians, community health workers who are used to doing this type of work. We have experience in doing outreach and assuring that the community is aware of the services that they need. We've been working in partnership with parenting communities for over 20 years, both formally and informally. And I think our contracting with them most recently has been an example of how we can deliver the types of services that are being proposed. We connect with almost all families in Leelanau County through our partnership with Munson and the Healthy Futures program. So we're introduced to families early in their parenting stages. And this would allow us to continue to serve them in the ways that they need. Not everybody needs the same level of service, but it would allow us to provide services that currently aren't provided. We participate in the Regional Perinatal Collaborative, which means we work with our hospital partners across the region, larger region, 21 county region, where we work with all kinds of service providers to assure that we have healthy moms and babies and young families. Most of our staff live in Leelanau County, are very involved in the community, know the people in the community, and to them it's not just a job. They're passionate about the work that they do, they're passionate about the services that they provide to the community. Our social worker, who works currently in the Parenting Communities program as well as other programs, has an infant mental health endorsement, which is in addition to her master's degree, which indicates that she has a very high level of knowledge and expertise in working with families with young children. It's a really important endorsement that someone who's doing this work should have. I think that keeping things seamless for families is really important. One of the areas that we work really hard within our perinatal collaborative to prevent is when people have multiple home visitors in their home. And because we provide multiple home visiting programs that have different eligibility requirements, this would fit into that picture of the other home visiting programs, so that if someone had to shift because of eligibility guidelines from one program to another, it's seamless to them. They're receiving the same services from the same person. The funding source may be different, but that's not something that they need to worry about. And then just as I said before, we're used to developing processes like this. We're used to developing work plans for things like this. We are used to really standing up to a high level of scrutiny from all of our funding sources. And, I'll just close by saying I think that with your funding from local appropriations, and the funding from Benzie County and their local appropriations added together, we provide a very high level of services for the people in Benzie and Leelanau counties. We administer nearly a $2.8 million budget, of which only about $600,000 to $700,000 are funded by the county. So we know the work that we have to do. We are constantly seeking funding and support to do it. We follow the rules. We make sure that we know what the rules are. We seek legal counsel when we need to assure that we're staying within those guidelines. And I believe that we are the best agency to administer this program.
Thank you. Thank you. Any other comments? I'd take a lunch break here now. What?
You kind of skipped over the early childhood millage funding options, and I would recommend to the Board of Commissioners that we discuss that, put it forward to next week.
No, that was the discussion with.
We had that whole discussion.
I would like to have further discussion on that.
Oh.
I'm making a motion to put it forward to next week.
Any commissioner can request that.
Well, put it on next week's agenda as a late addition or whatever, but.
A late addition.
Well, there was a motion.
Oh, was there a second?
I don't know.
I didn't hear a second, so.
I'll second it.
Okay. All those in favor?
Aye.
Aye, those opposed?
Aye.
Motion passes 5-2. So now we'll break for lunch.
How long?
Take 20 after.
Are we complete with
25.
the early childhood, so that these folks know they are done?
Yes, I will.
Thank you. Thank you.
Thank you.
I'd like to call this back to order. And the first item on here would be information technology and the approval of the phone maintenance agreement.
Mr. Chair,
Yes.
I move to recommend to approval of the support agreement with BSB Communications for phone system support in the amount of $8,825 with funds to come from the telephone fund number 656.
Second.
I have a question in there. Let me get to it here. Nope, that's the wrong one. Sorry.
Should be on page.
I found it. I have a question. The budgeted amount is $14,000, and the contract's amount is $8,800.
Yeah, what we're doing with this firm is we're buying blocks of time. I'll probably need to buy another block of time
Okay.
sometime in this month, in this calendar year, or
Okay.
fiscal year.
So that's
So
kind of what
I didn't want to spend 10 grand up front and find out that they're, not going to perform well or whatever, so.
Okay, that's my only question.
Yep.
Any other questions?
I did not request waiver of bids. Do we need to do that?
It did go out for bids. They were the only one that responded.
Okay,
So,
thank you.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. That brings us to B, approval of the Barracuda email. Commissioner Wesson.
Move to approve the renewal of the maintenance agreement for the Barracuda Essential Spam Filter in the amount of $57.50 with funds to come from the data processing fund number 636.
Second.
Commissioner Ansari.
the budget.
The budget amount's $3,500, we're spending $57.50. Do you have
I have,
the
yeah.
excess money from someplace else that you
I
will be
do.
able to cover this?
Yeah, if you look in the next one, I have excess in the next one, so I have excess. in
Just
the-
asking the
Yep,
question.
Understand. Yeah, it was more expensive, they raised their price, and we had more email addresses that were added, so what I budgeted was not enough for what the contract was for. It did go out for bids, one other response, it was more than this one.
Okay.
Okay.
Commissioner Wesson.
Move to recommend approval.
We already have it.
We have the motion already.
For the next one.
No, we haven't voted yet.
Sorry. All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Wesson.
Move to recommend approval for the renewal of our maintenance contract for our backup software from DLT. Annual maintenance of our existing licenses is $2,034.90, and requesting approval for the purchase of 2 additional licenses in the amount of $2443.24. way below budgeted amount. The 2 new licenses are for our 2 new servers, which were installed in part on the CAD upgrade.
Second.
Is that part of the motion, way below?
Michael got confused.
Commissioner Ansori?
Okay. Why is this one so much less?
I'm not really sure, to be honest with you. I had budgeted what I thought was an appropriate amount for the software relicense, but it just came in so much lower.
And you got 2 additional licenses.
And I know it. I was surprised myself.
Okay, so.
I don't have an answer for that, so.
No particular reason other
No
than just good
particular-
luck.
I think its
good
motion
luck,
is
yeah.
as presented.
I was just wondering if, yes,
I messed up.
support for that, if we could have the recommended motion from the bottom of the page maybe instead
Mm-hmm.
of the top.
Right.
Yes.
Support.
Yes.
So we're doing the recommended motion.
Yes.
And it's supported by Commissioner Long. All those in favor?
Aye.
All those opposed?
Thank you.
Motion passes 7-0. Thank you. Mr.
Uh-huh.
Long. We're at the potential approval of annual district work orders. Commissioner Ansel.
Good afternoon.
Good afternoon.
Okay, I'm trying to understand the requests for these different money amounts and where is it compared to your budget numbers?
I should have sent it out with those, but here's copies of them.
You can just answer the question too.
Oh, I'm sorry. Other way.
Right.
Well, our total budget is for $268,842.
No, my question is for the amount that we budget to give you.
Mm-hmm. Where is that?
Yes.
That's in mainly salaries. That's,
That's not what he's asking. What he's asking is the county gives you
Mhm.
an approved budget. He wants to confirm. I'm sorry, is this okay?
Yes, go ahead.
That
I'm-
you have, and what the board approved for your budget for 2020
Mhm.
was for conservation, education, and technical assistance, $40,343.
Correct.
Your approved budget, was that the amount?
yes.
Okay, and the soil erosion fees are just whatever you're gonna collect?
Correct.
And the water quality monitoring of $5,000, was that something that you had asked us for in your budget?
Yes.
You see, I'm just trying to make sure that the money that we have in our budget that we allocated to you, that you're staying within those numbers.
Okay, sure.
That's all I'm trying to do.
Okay.
I'm sorry.
Do we have a motion? Commissioner Redmond.
I would move to approve work order number 1, Leelanau Conservation District, for an amount of $40,343.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Okay. I would make a motion to approve Leelanau Conservation District work order number 2.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
I would make a motion to approve Leelanau Conservation District work order number 3 in the amount of $5,000.
Support.
Well, I have a question about it. Did you? Go ahead.
Yeah, yes. Can you tell us again, Buzz, is that just a pass-through for you?
Yes, yes.
And it goes to,
It goes to the Leelanau Conservancy.
the Conservancy does
Yes.
all the
They do
monitoring?
the monitoring. We get a report on what they're doing. They send us bills for the monitoring they do, and then we reimburse up to $5,000, which their monitoring usually goes well over that, so.
Okay.
Do we have a contract with them?
No, I don't think we do.
Should we have a contract with them for services
Well, they're
provided?
separate, they probably should, but that's through them,
Yeah,
would not be through
we
us.
probably should. That's a good point.
Do they test for E. coli or anything like that?
No,
No,
this is,
it's
this
just
is,
water quality, but that is part of it, you know?
Right.
And can they compare what our water quality is with what's in Benzie?
well, if Benzie has water quality testing done, it's not in the Great Lakes, it's in the inland lakes and the streams, so it,
Well, I'm just interested, they've had this septic ordinance for 27 years. I'm wondering if their water quality is better than ours, you know, because of that.
Yeah, I have no idea. We could probably determine that, but I know Benzie, they had some definitely separate issues with some of their water quality. The NR fishery thing there, they did some, well, it's court ordered that the fisheries cannot,
That's the
that
Platte River.
facility.
That's a little
Right,
different.
right.
Yeah.
And so, you know, we don't do the Platte Rivers.
That's right.
I'd say based on their beach closings, the answer would be no, because they had more beach closings this last year.
I've asked several people for that information, I can't seem to get it. You'd think that would be an obvious thing for us to know if septic ordinances are working or not.
Mhm.
But, okay,
That's a thought,
so,
sure.
are there any other questions? Yeah, go ahead.
Well, the language in this says that all field work and lab work will be contracted. And when I asked you about a contract, I believe you said you weren't sure or you don't have one?
We don't have one.
You don't have one.
No, it's a good point, and we probably should have one, yes.
But these are dollars spent from Leelanau County going to them for that purpose.
Mhm.
And so I'm confused why we wouldn't need to have some sort of a contract.
Because it's not with Leelanau County, it's with the Conservation District, it's a separate entity with their own board of directors. We allocate money to them.
And then they decide to
Yes,
allocate it to
yeah.
whoever, then why do we vote on it then?
We're voting on the work order.
Hmm?
It's for the work order to the Conservation District.
With the request for funding.
Yeah, that is actually a very good question, Commissioner Rushing, because over the years, I had the same thing. They go through the budget process, they submit it, it's in a budget, it's approved in the budget. Yet every January, they come and ask for the workers to be approved, which technically, I'm not sure why we are involved with that work order. If you approve the budget amount, it's
Exactly.
between Conservation District and whoever they wish to contract.
Exactly.
They can't get their funding without approval of
Yeah,
this work order. It's just like with the health department in the appropriations or anyone having appropriations. It's just like the addition later in the agenda for the capital outlay purchase. It was approved in the budget, but we still need your approval to.
At least through claims and accounts, correct? Because like health departments have appropriation, we don't vote on every quarter.
Those go through claims and accounts, but this here for this, we can certainly change procedure, but I always wanted to
Yeah,
approve these.
it's always
But
been
they're all
that way.
over
It's more of a-
5,000, so,
It's always
yeah.
been a tradition that goes through. In January, Mr. Long always comes every year with the work orders.
Right.
And Commissioner Rushton asked that same question last year about the
Yeah.
contracts.
Okay, Buzz.
I don't think we have, do you want another statement? Go ahead.
Well, just that I think the statement is that it's done contractually means you don't, one of your employees doesn't do it.
No.
You have somebody else do it. I think that's kind of the, but can there be a contract? Yeah, it'd probably be a really good idea because you should review what all they're looking for you and it'd be an easier way to get some reports back.
I agree.
Okay, all those in favor?
Aye.
All those opposed?
Aye.
The motion passes 6-1. Thank you. Thank you very much.
Thank you.
That brings us to Equalization Department. Proposed revisions of the database maintenance intergovernmental agreement.
This board approved the intergovernmental agreement that we worked on with corporate counsel at your board meeting on March 19th of 2019, and then we went to incorporate this document with the village, and they objected because the verbiage village wasn't on there, it just said township, so we sent it back to corporate counsel and it was revised so that now says village and township.
Commissioner
So it's
Redpath.
just a minor word change.
I would move to recommend to the Board of Commissioners to approve the intergovernmental agreement as reviewed and updated by corporate counsel.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Thank you.
Thank you.
Okay, and that then brings us to senior services?
No.
No, I'm sorry, equalization.
Oh,
You're
right,
right,
so-
no, you're right.
Planning
I missed it.
They're close, close.
Okay, I'm here today with the general plan, which I sent out in an email to all of you several weeks ago, as well as a copy of the changes. I did print a couple of copies out in case anyone wanted a hard copy. And then in the executive document summary, I have shown in here when the resolution was passed by you, that you had the right to either approve or reject the general plan amendment. And when the Planning Commission passed their resolution, so it's now brought back forward to you. And according to the Public Act, you can either reject the plan and send it back to the Planning Commission with a list of your objections so that they can work on those. Or you can approve the resolution or a similar resolution, which then adopts the plan. Feedback there?
Any questions? Yes.
What's it, so can we no longer just make a motion to recognize the work done on the general plan and to place the general plan on file?
That's correct.
Can no longer, or we can?
Right, that's correct, because you passed a resolution saying you wanted the approval or rejection of the plan. You can modify this resolution that I drafted for you, but it is a resolution of adoption. And it's draft, of course, stamped for you, so you can change anything you'd like in there.
I think, were you done, Commissioner Walker?
Well, I'm kind of out of line because there's an emotion, but I guess that's my concern with passing that resolution is that if there's anything we don't like in there as far as language is concerned, then we're forced to vote no on the whole general plan. And I don't want to vote no on the general plan, but I don't like some of the language put in or some of the sections put in. So, and I don't expect there would be support to take out some of what I have concerns about. So that's why, one of the reasons why I'm objecting to it. The other reason is that by passing a motion to approve it or to accept it, whatever, it's saying that here's the plan, let's go forth and do everything in this plan, at least as far as a lot of people reading it's going to be concerned. And that's that's the problem that I have with it. No different than I've ever had.
Commissioner West.
I move to approve the plan as amended and presented.
Recommend approval?
Move to recommend
No.
approval.
You're recommending today.
It's okay.
Well, actually,
His is fine, yeah.
Are you second?
No, I did not. Okay.
Well,
So it hasn't been seconded.
I'll second it.
Okay. Did you want to speak to that, Commissioner?
I was pleased with the changes in the plan. I attended one of the sessions when the Planning Commission worked on it. I understand Melinda's concerns about tying us down on every single thing, but I think it's just a plan. And we can modify it or move toward it or work toward completion of the plan when we are ready to do so. So I support it.
Commissioner
so I
Rush?
just have a clarification question. We will be voting on this by resolution next week?
Correct.
Okay.
Yes. Well, and I was wondering, in this plan, I didn't see it, I don't know, but is that tower that they're talking about for Verizon, is that in this plan?
No, it's not specifically mentioned in here. That came up,
That's on the agenda later on.
yeah, that came up after this was
Oh,
done, as
okay.
well as the capital improvements program, which was done for this year.
So if that's not in the plan, then, should we be discussing it without it going to the?
Well, I can address that. We actually had a discussion and got a legal opinion from Mr. Stoker
because we're not allocating any tax dollars for the plan. If the board chooses to, we would contract with Verizon, be their funds going through it and so forth, it does not have to go through a planning process.
All right, so it won't affect this plan or anything if it's not in it or in it. I guess that's what was my concern. Commissioner Walker.
Doesn't have to, but the planning commission did request that it do go
Yeah,
before
that's where
that.
I'm on the agenda.
I know it
Yes.
is, but I just want to make that point.
All right, any other questions? Commissioner Answer.
So are we moving to recommend at today's, or are we actually passing the motion?
We're recommending to move it forward.
That's
For a
not what I
resolution.
heard him say.
But all of these are just dependent on what's
I
voted next
understand.
week. Yes. Did Commissioner Sulis Little, did you have a question?
No.
No. Okay. All those in favor?
I'm confused on the motion that I made. Could the clerk read it?
Sure.
Well, I want to go back and play it because what I typed was a motion by Russell to approve the plan as, you move to recommend approval of the county general plan as amended, is what you said.
No, he didn't say that.
But he said
He
it's
did.
amended and,
Yeah, this says submitted, and that's where I was confused, and I'm
Right.
just going to ask for clarification of what the motion is before you vote on it, because I'm not clear.
well, where is that?
I did have the sample motion
said
at the
two.
bottom of the EDS for you. To recommend, a motion to approve the plan as submitted, and then in parentheses I have adopt a resolution, because you need the resolution adopted.
Yeah, but that's not in our packet.
You're talking about page 25, right?
Yeah, it is.
It's at the very bottom of the EDS document I submitted.
Yeah.
Or the other motion is that you reject it and
I would
submit.
withdraw my motion and restate it. The
Is that okay with the second, though?
Yes.
Yes.
All right.
I-
Okay.
Thank you.
I move to recommend approval of the county general plan as submitted.
All those in favor?
Second.
Okay. All those in favor?
Aye.
All those opposed?
Aye.
Motion passes 6-1. Okay, we'll move on.
Thank you.
Thank you. That brings us to senior services. I don't see, I thought April was
She
here.
was.
I will go grab her.
She was just here. I think she should have stepped off for a minute.
So the first one is the Area Agency on Aging. Do you want to wait till she comes in, or
Probably not, it's pretty
it's a
much
potential
housekeeping.
approval of that? And I'm not sure what MIPPA is.
Here she is.
Sorry.
Council.
Good afternoon. Hi. So I can make a motion if it moves along.
Yes.
I would recommend to allow Leelanau County Senior Services to enter into an agreement with the Area Agency on Agency of Northwest Michigan to provide MIPPA beneficiary outreach and assistance services for seniors. Contract agreement will begin October 1, 2019, and go through September 29, 2020.
Second.
Commissioner Ansel.
We did not budget this.
No, we did not, because at the time of when preparing the budget, it goes through the Older Americans Act, and the Older Americans Act had not been renewed through the federal government, and the MAP funding at that time was questionable as whether or not they were going to continue that on the federal and state level. So I did not anticipate, was not sure if we were going to continue with this.
But the anticipation is that we will get that $1,000 back in reimbursement for 10 people or whatever.
Well, so far we actually received a check, and that's on the agenda today to approve a contribution for the $1,000, and that $1,000 is used to for outreach work. So we send out, last year we sent 550 letters to seniors who are going to be turning 65, educating them about MAP services and signing up for Medicare. Yeah.
Commissioner Redden.
What is MAP? You're talking MIPPA.
Yeah,
right? We
okay,
don't know
so
what
we
that
have
stands
different,
for.
yeah, so it's all in combination. So MAP is Medicare Medicaid Assistance Program. And so we have a counselor that does that type of counseling, signing people up for Medicare. Then there's the MIPPA, which is Medicare Improvements for Patients Providers Act, which is a legislation that they use that the MAP counselors use to help sign people up that are lower income, they can have their Medicare paid for, so that it's not coming out of their social security check when you're using that. It's kind of complicated, all the acronyms and how it works, but it helps a lot of people. Last year, we were able to help 188 seniors, so, with the
Commissioner
services
Lautner?
combination.
Yes, I'd like to amend my motion, just to add up to $1,000 and add that maybe right after the outreach and assistance services for seniors, the third line down.
So there could be more than $1,000, because we already received $1,000, and then if they're able to help, the MAP counselor is able to help someone get the benefit from that MIPA money, then we could get an additional $100.
Oh, up to $1,100 then?
Depending on
It
how.
says funding not to exceed $1,000.
I think you're talking about two.
Yeah, I don't know if it's
Okay.
the same one.
Well,
I think you're
MIPA
talking about two things
reimburses
at
up to
once. The first is
$100.
just approving the contract.
Mm-hmm.
The
But
grant
it
is
says
separate.
not to exceed $1,000, so that's for that for something else? It's in your explanation.
We didn't have a second on your motion.
For my amendment.
Yeah.
But I still would
MIPA
like an
reimburse
answer.
partner
But the motion-
agencies up to $100 for each successfully submitted application for assistance with that Medicare, and up to 15 enrollments, and it does not go exceed $1,000 in that refund. But also in the contract, it talks about giving $1,000 to us for for our outreach activities, which would be mailings or different education things that we do.
But that's a second request, right?
So the second request is we received that
For this
$1,000
request,
for
if
the
we were-
outreach activities.
If we were to put a not to exceed for this contract or this agreement, what dollar amount would we put in there?
I guess it would be $2,000.
Okay.
Yeah.
So I just suggest we might do that for Tuesday night. Is just have, if we're going to enter into an agreement, we should know how much we're going to enter that agreement for. At least up to.
Commissioner Rushton.
Let's look at what was written here. You put the contracted amount at $1,000. The reimbursement partner agency is up to $100 for each successfully submitted application, up to 15 enrollments. So you can't exceed 15 enrollments?
Correct.
Okay. If you, is the cost any higher for 15 or 10? Is there a difference? Is there a fee?
We don't pay anything. It would be money that would come to us.
Okay.
Yes.
So you could receive up to $1,500.
Correct.
So in this first one, we're paying $1,000,
We're
and the
not
second
paying-
one, we're getting it back.
No, we're not paying anything. We have to have an agreement with the area agency. This is a grant that the area agency receives, so it's a subcontract, a sub-grant, essentially, a subcontract agreement. And so they have the contract with the state level. So, we have, then they distribute the money down to us. They're giving us so the contract is for, they will give us $1,000 for outreach activities, which in the past we have sent letters. We've done advertisement, bringing awareness to signing up for Medicare, and for those that are lower income, the assistance that could go to that. We have a Medicare and Medicaid assistance program counselor that volunteers, that works with our seniors who are signing up for that. If he is working with a senior that is low income, meaning that they make less than $16,800 a year, then they are eligible to have that Medicare not taken out of their Social Security. So if he is successful in applying for that, then the state will give us $100 per application. We can only receive up to 15 of those applications.
Compliance.
Yes, but that is also dependent on the funding for the whole state, because they monitor that as well.
Oh.
So
Commissioner
it's
Ansel.
not guaranteed.
it's not guaranteed.
Okay.
Commissioner Ansel.
So this $1,000 here is revenue.
Yes,
So it should be a negative $1,000.
yes, it's all revenue.
But she's going to
Commissioner
provide,
Ansel, yes.
You know, my point here is, I was looking at this $1,000 as $1,000 expense that we would have to come up with that wasn't in the budget,
Yeah.
and it's really a
No.
negative $1,000
Correct.
expense.
Yes.
It's revenue coming.
It's revenue.
That's why I played dumb and asked the question.
but.
Go ahead.
Okay, but for this motion, you're going to enter into an agreement with the Area Agents on Agency to provide these services.
Correct.
So since you're going to enter into an agreement with them and you're going to give them these dollars, they're going to give us these dollars. Okay, so we are going to accept these dollars then. How many dollars are we going to accept?
Won't be more than 1,500.
I don't know. It's going to be based on those applications. So I guess if you want to look at that, so I'm going to give it to be $3,500. There's a possibility of that.
So what you've got
Let's
is
just-
your $1,500, you're going to get up to $1,500.
Or
if you-
$2,500, excuse me.
There we go.
Yeah, yeah.
All right, so up to $2,500.
Correct.
That's where I was going, okay. That's what ought to be in there. I think this could be clear for Tuesday night. Can we get that clearer for Tuesday night?
So you want us, may I?
Yes.
So you want us to draft a motion to enter into the contract limiting the amount that we receive up to $2,500? I'm just asking because what if she
Well, it
has-
can't be
yeah.
more than that.
Well,
what
you
she
never
said.
know with the state, if more funding becomes available and they don't go, they may allow your county to get more.
There's that possibility.
So you don't know?
I don't. I don't.
The way it's
Okay.
written, it could be 2,500, but it could be more. I mean, we could come back and amend it if we had to.
Okay.
We just don't want to tie our hands too much. We can do whatever you want.
If it can be more than that, I'm fine with that, but that's not what I just heard all kinds of numbers
Yeah.
here, so.
Do you want us to do it? Are you- what's your
No, it's fine. It's fine. If it,
I mean, if this doesn't put a limit on it, I think we should leave it the way it is.
Exactly.
right.
Because it's negative expense.
Right, right. So I do
Bill
think...
doesn't help with budgeting, but that's okay.
No, when we get more money, that's a good
It's a
budget.
good thing. Okay, I get it.
So I do think we have the motion on the floor to accept
Mhm.
this.
Mhm.
Is there any other questions? All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Understand my confusion.
Thank you.
Sorry for the confusion.
Thank you.
Okay, so Area Agency has already sent us $1,000 for our outreach activities related to this grant, so I'm asking for approval to accept this contribution.
Commissioner Westman.
I recommend to allow Leelanau County Senior Services to accept a contribution from the Area Agency on Aging of Northwest Michigan for providing seniors with MIPPA beneficiary outreach assistance totaling $1,000 and placing into the Leelanau Senior Services contribution from other agencies account ending in .677.000.
Second.
All those in favor?
Aye.
All those opposed?
I had one question. Is that
Okay.
the same $1,000 you spoke previous? Okay, so why didn't that motion come first? Would that have maybe demo?
Well, because I think you had to approve a contract regarding the $1,000, so I did it that way.
Okay.
So that you
All
had
right.
approved that, and now you're accepting the 1,000.
You still confused us.
Yeah,
I'm sorry.
well,
It's,
okay.
it's, the whole thing is it's a confusing program, but we got money, so.
Yeah.
And we're
Motion
providing good
passes
services.
7-0.
Thanks, April.
Thank you very much.
Thank you, April.
All right, so then that brings us to Park and Rec.
All right.
Congratulations on your patience today.
I vote for chili number 7.
Oh.
Good afternoon. The Parks and Rec is here seeking you to take action on 4 different recommendations. The first being the approval of the 5-year 20 to 24 Community Parks and Recreation Plan. I think as your packet reminds you, at the special meeting, the concerns were the editorial corrections required in the plan.
Commissioner Lott.
So I would recommend to the Board of Commissioners to approve the Leelanau County Resolution 2020 adoption of the 2020 to 2024 Community Parks and Recreation Plan.
Second.
Final draft. You want that one right now?
The resolution is the second on the agenda. You're just approving the plan now.
We have to approve a plan.
The second thing is the potential approval of the resolution.
Weren't there a couple more corrections in it?
Linda has those.
Okay.
Yeah. So, anyway, that's where we're going to begin with the plan?
Yes.
Okay, all right. There was, thank you, Laurel. Laurel went over this with a fine-tooth comb. As the final draft would have just two very minor changes. One is to add an apostrophe at the end of Old Settlers. Remove the apostrophe. Thank you. Page 30 on Old Settlers Picnic Ground. The second one was to clean up the misspelling of these trunk lines on page 8. And that would be the final draft of the plan. All in order after that.
So we have a motion to accept the draft, is that
Yes.
what it was?
Mhm.
Support? We have support. Is there any other questions or? Okay, all those in favor?
Aye.
All those opposed? Motion passes 7-0. So that brings us then, yes.
It would be appropriate to acknowledge all of the work of Laurel, and I think Melinda did say that, but Laurel worked hard on this.
Thank you, Laurel.
Nice job.
Thank you.
Yeah, for sure. If I can expand on that, we wouldn't be here with this plan in order today if Laurel hadn't put a lot of time and effort into it. So that's greatly appreciated.
Thank you. That brings us to the resolution.
Well, that is a resolution.
That was the draft.
Yeah.
I move to recommend to the Board of Commissioners that the Board of Commissioners approve Leelanau County Resolution 2020- to be assigned, adoption of the 2020-2024 Community Parks and Recreation Plan.
Support.
That was,
Go ahead.
well, that was my motion, and that included the final draft of the plan. That by accepting the resolution, we're accepting the plan.
Well, that's not what I understood.
Right.
The clarification he made was that we were doing step 1, now we're doing step 2.
Okay.
Thank you.
So this is about.
It was
the
not my motion, though. My motion included the resolution.
Well, I don't know. When I clarified it, I left the resolution out of it because it was in the next one. So.
Okay, but I didn't, that's fine. I just didn't amend my motion, but you can vote on it again if you choose. That's fine.
All right. So this is for the resolution. All those in favor?
Aye.
All those opposed? Motion passes 7-0. Sorry about that, Linda.
That's the way this was written.
Yeah. So then that brings us to.
But the motion's a motion.
Yeah.
Approval of the MNRLTF grant. So this is a
Excuse
grant
me.
application. Yes. go ahead.
Approval of the, giving the Parks and Rec Commission authority to go ahead and
To
make the
apply
application,
for it.
to make the application.
Commissioner Locke.
Okay, I would recommend to the Board of Commissioners to approve the Parks and Recreation Commission's request to apply for a 2020 Michigan National Resources Trust Fund grant in the amount of $331,900 with the county's match of $95,000.
Support. Commissioner Anderson.
Where's the $95,000 coming from? It's not in the budget.
Same
Keep-
place,
One part of the answer is, keep in mind that Parks and Rec is setting aside $10,000 of its budget, which you have given to Parks and Rec. They've done it now 2 years. It will be 3 years by the time any monies come from a successful grant application. So not quite a third of it comes from the Parks and Rec budget.
Where is the rest of the money?
Yeah, I'd like to,
There's
Michelle.
there's no money set aside.
Yeah, let me clarify that. When the board approved this 2 years ago, the Parks and Recs agreed to set aside 10,000 a year, but that grant was never approved. So that money every year, like every other budget, turns over
It went
the
back
general fund now.
into the general
So there is
fund.
no fund with money set aside for the last 3 years.
But we have not spent
But you
that.
could, in theory, from now on, if the grant is approved, put $10,000 a year in. But all the money that was the last several years went back to general fund.
So there's still at least 20,000 right there sitting in general fund.
Where's the money coming from?
General fund.
So yeah, I'm sorry.
go ahead.
Are we going to take the money from the general fund? I'm just asking the question. Now, there's no money out there. Are we just gonna take the money from the general fund?
I would guess that that's where the request would come from, if we're successful. We don't know that we will be successful.
I understand that, but, we gotta know where the money is before we spend it.
Well, what was it, 2 years ago, we approved giving, I think it was 93,000 at that time, toward it, and that never got spent because it didn't, so,
Because it didn't go through, yeah.
So are we gonna do the same thing this year, even though, we spent $1 million here and $1 million there? Like, if we want to, it's gonna come out of the general fund, or it comes out of our, what is it, our set aside, what, I kept trying.
Contingency.
The contingency.
Can I ask the treasurer?
Sure.
Are we overextending ourselves?
Should have asked that this morning.
General funds, that'd be your first option. And if we're over on our budget, it'd come out of the contingencies. Depends on how much you guys spend this year.
Commissioner Wesson.
Thanks.
Yeah.
A lot.
Our three parks are gyms, and we do need to take care of them, and approving this today would not commit us to anything except allowing the Parks and Recreation Commission to prepare the grant. Should we be lucky enough to get the grant, at that time, we'll have to make a decision whether or not we can find the additional resources. So I think we ought to approve of this and ask the Parks and Recreation Commission to move forward, as we gave them approval to do 2 years ago. We haven't spent much money on our parks, and our parks are gyms.
Sorry.
Well, we did just approve 375,000 that we're gonna take out of the general fund, for early childhood development. So we have to realize that that's come out from somewhere,
Gotta come from somewhere.
Right. Commissioner Rushton.
How much is it going to cost us to make a proposal for this grant money?
To finish the application?
Yeah,
$2,000.
2,000? And this grant, is this specific for 2020, the year 2020, or is that grant available in coming years? I mean, is there a timeline the grant's available for 3 years? It's something that comes every year?
If I understand your question correctly.
What's the cycle of the grant?
Yearly.
Annually?
Annually.
So if we, for some reason, cannot seem to find the funds for this year, though that grant application would be available to Parks and Recs to seek next year. Is that correct?
We could seek the same kind of grant. I suspect it'd have to be some tweaking of the application.
Of course.
But will the MNRTF grants be available? To the best of my knowledge,
Okay,
they have been
that's what I'm
available.
wondering. This isn't just a one-time opportunity for us to improve our parks. So
No.
I guess the point that I'm making is, because of the dollars that we seem to be spending like it's water, we haven't really had a chance to look at our funding or our financing. And if this is something, it's certainly not urgent, it's not a life or death situation in my position. Is it something we would like to have? Yes. Is it something we need? Not necessarily. So with that said,
If I may add this only, should an application made this year be approved, that approval, of course, is not known to us until next December. The earliest possible time monies would be required from, any monies, not the full 95,000. The earliest possible time that monies would be required from the county would be August or September of 2021, and the expenditure of the full grant monies can be stretched over with a 1-year extension can be stretched over 3 years.
to further this conversation, and correct me if I'm wrong, if we approve this today, a fund can be set up where they can take their budgeted dollars and put it in that fund and it'll roll year after year?
Where that's not normal, we'd have to check with the auditors to see how to do that. They're part of the general fund, and anyone who has left over, you would have that.
Okay, I was just asking the question.
We certainly, we will check.
I think what you can do is when you make the allocation for the Parks and Rec, wherever that amount that is, specifically allocate $10,000, whatever amount is for this project. But you have to do that during the budget process.
Right.
That has to be done, if I may clarify, then you're saying that has to be done by this body's
Yes.
budget
Yes.
process, not the Parks and Rec.
Right.
And my other question here is, there was some discussion about donations. Now, I know the sheriff has come to us on several different issues, and the sheriff's department has gone out for donations for certain wants. What has Parks and Rec looked at as far as donations to offset the cost of this park?
Zero. We have also not done anything to advance what we said 2 years ago in terms of seeking additional grants to offset parts of the 95,000.
Okay.
The reason, now, this is not relative to donations. The reason that we haven't done the work for the additional grants is because that money, again, won't be needed for a period of time in excess of 1 year from right now. Most grants require that you at least begin spending the granted money within the year that the grant is issued. So there's a timing issue there in terms of when do you want to succeed in getting these additional grants. Certainly that is still the intent, to reduce this 95,000 commitment from the county with additional grants from other outside sources. That work has not begun yet. Relative to donations, have we done anything, Ty and Melinda, about
We're always
donations?
open. We haven't done a campaign to donate.
We haven't done a
but
campaign. We
yeah.
certainly have accepted some of that kind of
Yeah.
work with Old Settlers.
Yep.
Relative to Veronica and the development that this grant would be seeking, we haven't done that.
Okay. Thank you.
So I believe we have a motion on the table, and all those in favor?
Aye.
All those opposed?
Aye.
So the motion passes 5-2. So, thank you. Then that brings us then to the contract with Gosling Zuback.
And this, Commissioner Rushton, as you see, this is where the $2,000 answer came from.
Yep.
Commissioner Walker.
I would recommend to the Board of Commissioners that they approve the amendment to the agreement between Leelanau County and Gosling Zuback Engineering Services Incorporated for the work on the 2020 NMRTF grant application process in the amount not to exceed $2,000. And funds to come from Parks and Rec, I guess.
Support.
Number.
Okay, thank you. Commissioner Answorthy.
Where's the money coming from? It's evidently we don't even have $2,000 in the budget for this?
I think, did the motion not say funds to come from Parks and Rec?
It was left open, and I said Parks and Rec. I expect Parks and
That's the
Rec is
same.
going to have to pay for it.
This is just
What
open
does that mean?
discussion now.
It's not in the budget, so where are they getting their money from?
Commissioner Rettner.
I think that Mr. Behrens had said that in the past 2 years that they've applied for this and they've set aside $10,000 to put into the general fund in case they get the grant to work towards that. So I would assume that the $2,000 would be coming from the general fund and it would be from money that they have set aside that was put into the general fund.
Okay, just clear, there was no money set aside. It's all in the general fund.
Well, that's what I mean.
But
It's in the
they get an
general-
allocation every year from the county board for Parks and Recs that they can allocate. So this would come from your 2020 allocation to Parks and Rec.
And
So
if I
it
may
is in the budget,
continue-
is what you're telling me. I'm sorry.
Commissioner Rettbach has the floor.
And if I may continue, when the time comes that the grant is accepted, that will be after possibly that we do our budget work next summer.
We would not find out about whether or not we win this award until second week of December next year.
Uh-huh. So it could be
Second
put-
week of December this year, but next December.
Okay, so it could be put into the budget for 2021, the amount that,
Commissioner Ansel.
I'm still confused. Is the $2,000 in their budget this year or not? It says, you know, on this thing that's submitted, it is
I think
zero.
Commissioner Wessel can answer. Go ahead.
If this board approves of it's going ahead, when we meet in Parks and Recreation Commission tomorrow, we can amend our budget and make sure this money's available out of the Parks and Recreation budget.
Commissioner Suislo.
Dave, my question is just a practical one. What is left with the application process? What is the work that they're going to be doing? And Laurel spent a lot of time going over it, but I'm assuming they have to electronically submit it, or
Oh.
what's left?
Oh, well,
'Cause it says
tomorrow, Parks and Rec will begin a final tweaking. This is a product that this is as far as we got last March in lining out the $331,000 project. We will need to tweak this some. We have not even begun to look at this because of the 5-year plan work until tomorrow's Parks and Rec session. Some of that work has to be done, but really the major chore will be uploading of filling in all of the blanks on the long application.
So it truly is completing the application.
Yes, and we have some completion work yet to do
Right,
on.
I understand.
On
Thank you.
exactly where the dollars go.
Thank you.
Commissioner Rushton.
On that paper that you just held up, it said the local participating match is $100,000, but you also have the Grand Traverse Band, $5,000. Have they committed to that?
No.
No, so.
This again is still
Okay.
reflecting only where we got, as of last spring, really, it was in February. And at that point, we were making a judgment that the work we were doing with the band would qualify for this $5,000 portion of the match.
Okay,
That
so-
work is not going forward.
So that's confusing for me because you're requesting $95,000. Could it in fact be $100,000?
No, we are not asking the county for more than the $95,000 back of.
That doesn't answer my question now.
It will not grow. It will not grow from 95,000, no.
Okay,
That's why this still will take a little bit of a tweak.
Okay,
To make the
okay.
95 match up to our 30%. It means probably a slight reduction in the
Okay.
331.
thank you. I
Mhm.
appreciate that.
Any other questions? All those in favor?
Aye.
All those opposed?
Aye.
Aye. The motion passes 5-2. Thank you very much.
Thank you very much.
Yeah.
Thank you, Dave.
So then, that brings us to the county clerk. Request to purchase MERS credits.
This is the request for an application for additional service credit purchase by employee Deputy Eb Bowen. He's requesting to purchase 2 years, 6 months of generic service credit from MERS. It would be at his own cost, which is estimated to be $56,009.
Commissioner Butler.
I would recommend to Leelanau County Board of Commissioners to approve the resolution for Everard B. Bowen to purchase 2 years, 6 months of generic service credit from MERS as described in the application for additional services credit purchase at a cost of approximately $56,009 to be paid by the employee.
Second.
And,
Go ahead.
and this has been done in past practice.
It's what we just did for a former employee about 1.5 years ago. It will, yes, you have done it before, and it is at his cost.
Commissioner Ansari.
I'm assuming MERS goes through a
They do.
actuarial calculation to say this is how much it's, we're going to charge you extra for this. So that we pass that on to the employee, and as long as everybody dies when they're supposed to, it comes out even, right?
Well, I don't know if I'd go quite that far, but yes.
But that's the theory.
That's the theory, correct.
You have such a way with words.
I'm just saying, this is a guess. This is a
Right.
guess, just like any other insurance.
His cost is fixed.
Yes,
Yeah.
There's no
he's
guessing
gonna
that.
pay that, but if he lives to be 100, he's gonna come out ahead.
Oh, correct. When you start drawing MERS and you become eligible, actually because of the amount of money he'll be invested, that's going to be the first money that's going to be drawn from versus the county pot of money that's sitting over there. This will fund the retirement at first till this has gone up, but then, yes, him, his beneficiary, depending on which option you choose, because there's about 8 different options to choose when selecting MERS. And when you're going to put this kind of money in, you need to be very careful about which option you're selecting because you want to get your money back.
Yeah.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. And then that brings us then to the sheriff's office, the proposed law enforcement promotion, staffing level adjustments.
Good afternoon.
Afternoon. Sorry this took so long.
Yeah, that's, sorry, it was not morning, but okay. Long day for all of you. So basically, this is a proposal to bring our rank and file, our supervision, our inline supervision model into compliance with Michigan, basically Michigan standards, MMRMA. And there's a letter attached to this request to that effect dated 2 October 19. And basically what we want to do is take 2 of our existing deputies, promote them to sergeant to get closer to the 1 in 3 model as recommended. Right now we have no daytime supervision on the road, and their sheriff's tied up with the budget and administrative duties. I'm tied up with the public relations, the media, administrative duties, management, and the jail administrators tied up with the whole jail operations, and the road lieutenant tied up with the road operations, meaning doing their day-to-day scheduling. We have about 100 special events, such as the Ironman. He's dealing with constant applications for alcohol permits and so forth. So we don't have that model out on the road during the day. At night, we have 2 shifts. We have the early week and the late week. Basically, we have a sergeant at night with 1 or 2 employees, and we're looking for the same model during the day. So kind of a straightforward request, bless you. Kind of a straightforward request, but I think we've been out of line on that model for some time. This reduces long-term liability for us as an agency as well as for the county. There's a lot of split-second decisions that have to be made on the road, in the field regarding vehicle pursuits, chases, warrants, warrant entries, and so forth into buildings or into premises. So everything from marijuana facilities all the way up to domestic. So it's good to have field supervision. So I understand it isn't something, or I hope you understand, it's something I'm asking for today. I'm asking to include this in our budget request for this year, to have it in our budget for next year. So starting next year, we would take 2 of the existing deputies and promote them to sergeant. If that makes sense.
So this request is for 2021?
That, well, yes, yeah, 2020's budget. We are, basically, we're gonna talk about that for, is it June, July, we start talking budgets, and we usually vote around October 1st, somewhere there. And so what I'm, I guess, asking you is what process should we use to go toward this model? Rather than ask for more money this year, which is not already allotted in the budget.
Commissioner Answer.
So we're gonna promote 2 people into these new positions. So these are new positions, so we're actually going up, head count 2?
No, we're staying with the same number of personnel. We're just, see, they have a thing in their union now where the senior deputy can actually get more wages for making decisions in the field, yet they've not had the specialized training and so forth. So we're not increasing the number of personnel. What we're doing is we're changing the status of 2 of them so that we will, and there'll be some shuffling around, like who's on days and who's on nights, but basically it will give us a road supervisor. So we're +0 as far as the agency. We're just changing the status of 2 of them to give them more supervisory responsibilities.
So that, you're talking about starting January of 2021?
Correct.
So the process will be you come to the board during the summer budget process?
Correct.
And present that time?
That's what I thought it was, but, you know, there would be discussion or questions, and I want to drop all that bomb at once. If it's not something that, you know, we can do now, which I don't think we can, we'll come with that with our budget process if I'm doing this the right way.
That would be the
Yeah, no, well, I think that would be perfect, because that's really, like we just asked the judge to come, you know, during the budget process.
Right.
If we want to change positions or increase positions or whatever, and that way we could do it through the budget and make sure that it's covered by.
Right, and then that way we wouldn't have to go outside the budget boundaries we've been talking about all day, so.
Right.
Not trying to be difficult about it, it's a model we really need, and I would really like to be able to look at that sergeant supervisor as taking care of day shift, you know. I mean, there's a lot of little things that go on, the public doesn't know about, that we're aware of, we have to deal with, and, you know, officers get in patterns and habits, and we don't like to see too many patterns or habits. And then in addition to that, there's a lot of leadership responsibilities, things put on them right away. And if I'm over here at a meeting, under sheriff's and budget process, jail administrator, road lieutenant's tied up on different things, we can't make those day-to-day field decisions. And there's a lot of decisions, you know, when that body was dumped down in Casson Township, I was there in 32 minutes, and there was already a deputy there ahead of me. And he's a mid-level seniority corporal, and he handled it brilliantly. But there's a lot of decisions, what to make, you know, who to call, where to go, there's a lot of stuff going on. We can't always have that quicker response being there. A lot of times we're tied up. For instance, tomorrow, all 4 of us in direct line supervision, first 4, are going to be at emergency management training down in Grand Traverse County on how to handle disasters and how to run emergency management centers. So there's times we're not there to make those decisions. So.
Commissioner Answer.
Who gets those positions is your decision, or is this a seniority?
No, we'll pick the most appropriate person.
Okay.
Seniority will come into play, but the old guys in this
your
are good
decision.
guy. That's correct, yeah. We'll have an interview board. Let's say 6 people put in for the 2 positions. We'll have interviews, we'll talk to them, we'll feel what feels best for the agency, and seniority will also be included in that. I mean, honestly, if you just got here, you don't have as much weight as someone been in here a longer time, but we'll pick the best candidates.
Commissioner Redden.
Oh, I had a question. Sorry. You said that at night there's a supervisor, but you want more supervisors?
Not night. During the day, we have no day supervisor because we're tied up with administrative responsibilities. So at night, we've got the guy on the road. And the one thing is about the deputy that gets promoted, they're still going to be doing the same thing they're doing now. It's just they'll have decision-making capability and they'll have that responsibility at night.
Mr. Rush.
I'm just trying to think through this process. Will the supervisor have different tools available to him, or how does it make it better to have a supervisor on the
Decision-making process. So you're familiar with the EMS and fire backgrounds, you know, you have your ICS system.
Yeah.
Basically, we have people out there on the road during the day. When we're tied up, we have no supervision
I have
to make
no
decisions.
supervision.
I mean, we do the best we can, when I talked to Steve about being undersheriff, I said, we're gonna wear a uniform, body armor, gun belt every day, we're gonna back the guys up, but we can't always be there on scene.
In using that analogy, I know, according to my medical licensing, I was only allowed to do a certain level of medical care. And once the required care superseded my license, I had to go higher up, make the phone call or whatever to ER. Today, if you've got an officer out there who is not in a supervisory position, how does that affect the maybe the behavior, or how does that affect the event that's occurring at that time? I mean, what's the advantage for the supervisor?
Well, the advantage of having a supervisor is, let's say our shifts start at 0600 and 1800, so 6 a.m., 6 p.m. And on your way in, there's a car accident. Who diverts who? So-and-so wants to stay on. Well, of course you do. You get 3 hours overtime for being on the accident. That supervisor say, no, you go home. New guy coming on, he'll take it. I'll cover it in between. So in the long run, it's better management of personnel. It's better management of money. We're less likely to have a situation where, you know, sort of the top dog of the day shift makes a decision over, you know, someone else, a supervisor makes that decision on behalf of the department. And the agency will always want to do what's right as far as personnel, how tired they are, how much overtime we're paying. Our overtime budget is limited, and we know that. So we don't want 2 or 3 people on overtime when we have 2 or 3 people just coming in. And believe me, it happens. And it happens so fast you don't realize it. All of a sudden, there's been a few times in the past we've been dinged for 30 minutes, you know, and stuff. And it's frustrating to me.
So basically what you're saying is when a situation or an event occurs, you're going to have a person who looks at this situation from a different perspective and a higher perspective. Not only are they taking into consideration the immediate events on the ground, but they're looking at the bigger picture.
The larger
over
picture,
time.
like med control, overtime, personnel usage.
Tiredness, so on and
Exactly,
so forth.
fatigue factors, so forth, where the cars are coming from. You know, a lot of our deputies live out of the county, and, you know, why have someone up in, who lives in Sunsby or Northport handle some in Empire when someone's coming right up through there? So some decision-making capability there and some supervisory, I guess, knowledge during the day. There's a lot of decisions about warrants and things, and, you know, how do you inspect marijuana facilities, and do you have the authority to check this car or that, or a right to do this or that? Difference between authorities and rights, and after they go to staff and command school, after they get more training, they'll get mentorship from the undersheriff, from me, from the lieutenant. Same way we have the model correction site. We already have this in place in the correction site. We have very little problems there. We basically have 1 sergeant and 3 deputies on that correction site. So we have 4 sergeants. And that's exactly the model we want on the road, so that we have 2 day sergeants. They have 2 day sergeants. 1 is working right now, and they have 2 night sergeants, depending on which shift it is. There's always 1 sergeant on.
Commissioner Wessel, did you have a question?
Yeah, and I'll defer to Michelle or Chet if this is inappropriate. We haven't had our deputies contract update yet, but how does this fit with current negotiations? And is it unrelated, or does this make those messy?
I'm just thinking out loud here, something other, if they would become a sergeant, they'd be in a different union, right?
Yes, they'd be commanding.
Right now, all the road patrols, the deputies are in 1 union. That's a group we don't have a contract with. The sergeant, the command people, the sergeant and the lieutenant are in a separate union.
Correct.
So if this would occur, whoever would get these positions would have to, would be.
2 of those deputies leave road union, go to command union, that's correct.
So that obviously from a financial standpoint, they're being upgraded.
Commissioner Redmond.
Well, if I recall your organizational chart when you presented it to us a few years ago, and from what you said today, you have 1 sergeant and 3 deputies underneath. And if you make 2 new deputies, then aren't you going to have like more sergeants than deputies, or an equal amount? Is it gonna be
No, there's still
one-on-one, or-
more deputies than sergeants, but it just brings us closer to the model of 1 and 3. It's not a perfect model, because sometimes people are on annual leave or they're sick or something. It's maybe a sergeant and a deputy at night working, or sergeant deputies during the day. So it does change that model by dates and times, but no, we'll get nowhere near 1-to-1. It will still be basically 1 to probably 2 to 3, depending on that.
Okay, because you also said something about the incident command, and when I took those classes as part of, my training, the person that's on the scene first is in charge of the
Correct.
situation.
Correct.
Until someone else comes.
Correct.
And if you're saying that there's currently 2 sergeants on a day and 2 on at night, wouldn't one of those go to the incident and be the supervisor?
Currently, there's
or-
none on during the day, and there's 2 on at night. So there's 1 on each night shift. So there's 1 on at night with at least 1 deputy. During the day, there's nothing. First one on the scene, let's say there's a shooting in Northport.
Well, I mean, we can discuss this at budget time. I mean, I know this is all good information. Did you have another question for him, or?
It's fine if you want to interrupt me right now, that's fine.
No, I'm letting you go on. I'm just saying that this is budgets, you know. Commissioner Sudas-Little, did you have something?
Just a question for clarification. You have a supervisor on night, but you don't have one on the day.
Correct.
But you want 2 promotions.
Yeah, see, we have 2 shifts. They're in 12-hour days. So we have basically a first of the week shift and a second of the week shift. That would give us 1 sergeant on each shift during the days to match the night model.
Commissioner Ansel.
My only comment is when we start discussing this during budget time, if you could look at some of the other counties that are similar sized and say what we're proposing falls in line with what other counties are doing. It'd be helpful information to look at it to say, yeah, this is a function of being a small county. If we had, 100 employees, it wouldn't be, this would already been sorted out. So, for when we get to that discussion, if you could do a little bit of research, I don't know if you have that kind of thing through the Michigan Sheriff's Association or whatever, to say, what do similar sized counties do in this situation? That's all I would ask.
Okay, I'll do that. We're a little unique because we're a peninsula. So I'll do what I can in that way.
I'm just, it would be helpful information. Thank you.
Okay.
Okay, so then we move on to propose potential approval of video camera replacement purchase.
Good afternoon. During the 2020 budget preparation process, the board approved $15,000 in capital outlay to complete a portion of the upgrade to the jail security cameras. I believe the initial ask was 30. After your guys' discussion, I believe you agreed to 15 and 15, 15 for 20, 15 for 21. So basically, I'm just coming forward to ask for approve all the expenditures for that project, all to come out of the noted fund not to exceed $15,000.
Commissioner Rush.
I would make a recommendation to this board that we approve all the expenditures for the jail camera upgrade project from fund ending in 970, not to exceed the $15,000. Is that your request?
Yes.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Thank you.
Thank you,
See you at
gentlemen.
budget time. I'll do what I can on that.
So then that brings us to administration and the League of Women Voters. Commissioner Faulkner.
I would recommend to the Board of Commissioners that we develop a tree/plaque donation policy for this campus before we move forward.
Is that a motion?
Yes.
I'll support that.
Go ahead, you want to address?
The reason I asked to do that is because I think a couple of different things. I think it's really important that we know what we're doing before we get going. Parks and Recreation spent some time developing a policy for the reason that we wanted to make sure that the tree donated wasn't just a little whip that would die. The tree has to be at least so big, it has to be a bald tree, etc., so that you have a good-sized tree. So we said what type of tree it had to be and what variety of, what size of tree and then what variety, so that we didn't end up with,
Pine cones everywhere.
Pine cones everywhere, the red pine or jack pine or even a locust tree or something like that. So the type of tree, the size of the tree, etc. Then we should know placement. And we also didn't want our parks to start looking like memorial grounds. And therein comes the plaque. So we should really decide, do we really want to do plaques on our trees, etc. So that's my thought. I think that we should have those discussions at this board first before we begin to accept donations and start plopping things places.
Commissioner Ansel.
We have a Buildings and Grounds
Yeah,
Committee,
yeah,
do we?
yes.
Yes.
In theory.
Well, I think this would be the next
Yeah,
one.
just to follow up, actually, I don't remember what year, I read somewhere that you actually did set a policy that all those requests have to come directly to the Board of Commissioners, go through the Buildings and Grounds Committee. I know I read that
What a
somewhere.
good idea.
That was
Okay.
actually, pretty much everything you have suggested, the
Okay.
board at some point agreed it has to go through this board
Okay.
for final approval. Do you remember when the Binsfield family wanted to put that bench
Bench,
at the
exactly.
Parks and Recs?
Mhm.
I think that's when I did the research, and it said it had to come back, had to go through Parks and Recs, but also had to be final approval, has to go through this commission. I believe on the Parks and Recs, they can recommend, the final decision is with the board.
Okay.
And so I think basically what you're saying is.
Well, it should go to that committee then,
Yeah,
first,
Yes.
before it comes here.
Commissioner Ansel.
I do want some kind of policy because, you know, whatever we do, I want to be consistent. But I also don't want, you know, yeah, we're going to plant a tree here and here's a 4-by-4 foot sign out there saying, you know, in memory of whatever. But, you know,
Yes.
I'm not, you know, just my personal thing, I'm not opposed to a very small plaque, but, you know, let the Buildings and Grounds come up with some kind of recommendation for us and then we can debate it.
Well, I think a good example how the system worked well is when Michigan State did this garden here. You remember they put those little signs up there? They came to the board and got that approved. So we have past precedent. That's what we've done.
Commissioner West.
I agree with doing that, but I would urge us to do it quickly enough so that when the 100th anniversary comes this summer, we're ready to do something with the League of Women Voters. That's a pretty important anniversary. And it seems to me like the Buildings and Grounds or this body could develop that policy and still meet the deadline.
Commissioner Soto.
Have we allowed on this campus planting of memorial or acknowledgement trees in the past already?
Well, technically, with the Gallagher, but that was actually approved on the other campus. So
Right.
I would say the answer to that is no.
We approved just moving it, we moved it here.
A board in Leland, so if you look at that, you count moving that to this campus, they move that, they move the rock.
We have a tree on this campus.
But that was approved
is-
by that board on that
Okay,
campus. Yeah.
physically. Okay, just clarifying, I am not opposed to developing standards or any other thing that we want to do, because I think that's a good idea. But I agree with Commissioner Wessel, it would be prudent for us to move on this, and I think we can.
We can set up a committee meeting quickly.
Commissioner Locke.
My only final thought on that is get the policy in place for whatever else. But it would have made more sense for me for this group to plant trees at voting precincts or areas like that. We don't vote here on this campus. So this would have meant more, you know, in Solon Township next to the town hall, or in Cleveland Township next to the town hall with the little plaque where people come to vote, would have made more sense to me. But that's, we'll send it to committee.
Commissioner Ansel.
This is probably a question for Melinda more than anybody else, but did we have a landscaping plan when this campus was approved?
I would say no real plan, no.
Well before my
No,
time, but
no,
I didn't
not
know if
really.
there was a plan out there that says this is where we anticipate that we're going to have trees, and yeah, we have 5 empty spots out there that we could plant trees in, and it goes along with that plan. I don't know if there is or isn't.
Well, let me do some research to find out next Tuesday if there was. I've never seen one. But
Yeah, not that I don't remember at
We can
all.
look into that though.
There was a decorating committee, and that's all I remember.
For inside.
That was inside.
Yeah.
That was inside, and it wasn't, I mean, I know that the plants out here were decided, and the walkway was part of that.
Part of
So
it.
there was some landscaping decided by that committee. Yeah,
Could we move this forward to next Tuesday night then?
Sure. And do we have a motion? No, we have a motion already on the table. To that we send it to the committee.
Well, it's got to go to committee. I don't know
Yeah.
how soon the committee's going to meet.
Her motion was to move it to the committee. And that was seconded, so that's what we have to vote on that.
No?
No.
No, what does it
The
say?
motion is to develop a policy,
Oh, develop the policy.
but We have a policy already.
Policy before moving forward.
So, yeah, so we need to see the policy.
We'll have to find it if we.
Right.
Yeah. There was at least a motion. I don't know if there's a policy, but
Okay.
we'll get more information by next week.
Okay.
All right.
So
So you
this is for
withdraw,
developing a
just move it
policy.
forward.
Yes.
Yeah, that's
We've got
fine.
it. We
I
have
would
it, so-
withdraw that motion
Okay.
and move this to committee. Because you can find all that out at committee.
Is that okay with the second?
Yes.
I'm sorry, could you repeat that? You're withdrawing the motion and making a motion to...
To move it to committee. Buildings and Grounds Committee.
And that was seconded again?
Mhm.
Yes. So that's what, yeah, Commissioner West.
I'd offer an amendment to that motion,
Okay.
that, and bring it back for our February meeting for Board of Commissioner review and decision.
I'll second that motion.
Okay, so first we'll vote on the amendment that we bring it, the policy, is that what you're talking about when you say bring it forward, the policy that she's talking about? Okay, from the committee. Okay, all those in favor of that?
Let me get a
Go ahead.
clarification first. On the letter that was sent, what's the date of the event?
I don't think it said, did it? It said a year. It said the year.
I don't see,
August 1920 is all it says.
August.
Okay, so we've got till August to get a tree decided on, purchased, planted, is that correct?
in theory, yes.
Yeah.
yeah.
So if this takes us till March, how does that hurt the project?
Commissioner Sudas.
Since we have two amendments, unless Commissioner Wessel wishes to withdraw his first one, I would like to change that we have a report back that we can act on. If August is the thing, you've got purchasing and planting and whatnot, by the end of March, so that we address it in our April meeting.
Thanks.
So report back by the end of March for our April meeting. Does that make sense?
It gives us a little bit more leeway.
Yeah.
I will withdraw my amendment. I just want to make sure it happens before it's too late.
Well, I also recognize there's a planting season that's best.
Yes, exactly.
So, and, you know, it's either going to be spring or fall.
Commissioner Ansari had his hand
I
Go ahead.
withdraw my comment.
I was just gonna say, you know, if you're gonna plant a bulb tree, you're gonna do it in the spring or you're gonna do it in the late fall, one of the two, you know? So if you want to be able to have this done by August, you better plan on having it in the ground before May. So that's, you know, if you're planting a bulb tree, that's all I'm gonna say.
I'm a farmer too.
Yeah.
I get it.
Next, yes, we just move forward next week to see if we have a policy in place.
Yeah.
1 week is not going to make a difference. Let's move forward. By next week, we'll know whether we actually have a policy in place, whether we have a long-term landscaping plan.
I don't think you can make a motion.
No, I'm just suggesting that. No, I'm just suggesting that. Because I think we're all saying the same thing.
Right.
So just move it forward, that would, I think.
I'm not sure what motion is on the table right now.
The motion that's on the table from my perspective is to move this to Buildings and Grounds Committee.
Okay.
It was amended and then withdrawn, and then I think amended
To
again
get it back by,
to get it back by the end of
April.
March.
But that one wasn't seconded, to move it to end of March.
I don't know if it's.
No. So, okay, so the motion on the table is to you set it to committee, you know, and we'll get this, that'll move it forward to next week.
Okay.
All those in favor?
Aye.
All those opposed? The motion passes 7-0. Thank you. All right, so now we're at the Verizon Tower update.
Yeah, I just want to give you an update. As you know, last month you heard a presentation from two gentlemen from Verizon about potential putting a tower on this campus. You authorized myself and Matt Anzor to enter negotiations. We have done that. As they stated here last month, they proposed a lease space for approximately $13,000. We have not recommended that to your board. We are negotiating with our legal counsel and their legal counsel. I don't want to publicly debate in the media what we're talking about, but we are proposing at some point, hopefully maybe as early as next week, maybe next month, to come up with a contract for you, but it's different terms than what Verizon is proposing. I feel uncomfortable stating the terms publicly because I don't want to get in a media contest on what we're proposing versus what they're proposing. But the two attorneys, I also have talked to somebody, I can't remember which commissioner asked me, if our legal counsel has done this with other counties. Yes, so they know what the going rate is. I also have an acquaintance that is in this business professionally, and he gave us, Matt and I, some very good advice on what things that should be in the contract in terms of co-location of companies and the financial impact that would have on us versus just them. So we are putting that in the contract too. If you want more specifics, talk to me privately and I'll give you the update. But if you'd like to just move this forward to next week, I appreciate that.
Commissioner Wesson.
I recommend that we move this forward to next week's meeting agenda.
Second.
Yeah, I guess I would like us to try to send it to our planning commission too before we actually vote on it here to put it in. I'd like to hear what they have to say. So I'm going to oppose this motion only on that, but what?
I'll give you an update on that too.
Okay. Okay, any other comments?
Well,
What action is expected next week
yeah.
if this is moved forward?
I don't know.
The best case scenario is you get a copy of the contract to review.
Okay.
But I don't think it's going to happen by next week. I'd be surprised if we have a proposal by next week. Realistically, most likely during the month of February.
Any other questions?
Well, that was one of my questions. My other question is, two things. One, your planning commission did ask that it come before them for discussion. My second point is that I think it's really important that we develop a policy for this campus before we start accepting businesses to place their business on this campus. With placing it with no policy. We did not have a say in they selected the spot they wanted it. They chose us for a reason. I think that we're circumventing Sutton's Bay also by doing this. That's a real problem I have. I have a lot of problems with the whole issue, but that's my main concerns.
So the motion is just to move this forward to
No, I
next week?
understand, but it's moving.
Okay. Any other comments? All those in favor?
Aye.
All those opposed? Aye. Motion passes 5-2.
In terms of going to the planning commission, by law, if you allocate state funds, it has to go to the planning commission. It doesn't mean you have to accept their recommendation. So, but because this would not be our tower or our funds, we asked Mr. Stoker, Trudy and I to get an opinion. And legally, it does not have to go to planning commission, but that's the decision of your board of commissioners. If you wish to forward it, you have that right. It's not a requirement, though.
I understand that it was a request, and neither will they make a recommendation.
They
They'll
could, in
give
theory.
us staff. We don't make recommendations. Am I correct, Trudy? It would be staff comments we would forward.
Well, and the planning commission reviews it for character, location, and extent of the project.
But that'd be up to the subcommittee to decide if you wish to forward that to the planning commission.
So that brings us to Leelanau Clean Water.
Yeah, let's talk about that. This kind of a joint presentation by Trudy and I and Michelle. Is Laura going to take minutes?
Can I have a 30-second?
We'll take a
Yeah, why
little
don't we
break.
take a little break just
All
to
right.
go to the bathroom? Just 5 minutes, please. 5 minutes.
Well, look at this. No, is there more to it?
Yeah.
In order.
Back in order, yes,
Back in
thank you.
order. Just helping you out.
You're very good with that gavel, by the way.
Yeah.
I have one of these at home.
To throw, or?
Has it got a point on one end?
It's for the kids.
Oh, yeah, okay, for the kids. All right, well, Clean Water, I just want to say that all three of us up here really respect the work that they do. It's valuable work and a lot of dedicated people. So the issue is not the work that Clean Water is doing. It's the structure or potentially the lack of structure in place. And we're just asking for clarification. So if you see, in 2008, the board passed a resolution setting up a Clean Water Task Force. As far as we could tell, and some of you were here at that time, there's been no future action taken by the board. So this is 2020, so that's 12 years now. They have been operating a task force, doing great work. I mean, there's no debate about that. However, if you look at their structure, it's unique. We have no other group, committee, task force, commission operating the way they do. They are not appointed by the board. There are no terms in place. There are no bylaws approved by this commission. If you look at every fall, you appoint people to different boards, committees, task force. There's terms, there's term limits, so forth. None of that has taken place with Clean Water. Several years ago, there were some people that asked, how can they get appointed to Clean Water? Because they had some issues. There is no process in place. And so we're asking for clarification. Also, we found out that, I think unintentionally, there may be some issues with the Open Meetings Act. There also been a question on who are members and who are not members, who gets to vote. They have their rules in place that this board has never approved. And basically, you're a member, but then you can have an alternate. If you're not there, that person gets to vote. And we have some occasions where people come and say, well, I'm an alternate to an alternate, and therefore I want to vote on this issue. We've had people in the audience making comments about issues, trying to second motions, trying to change agendas. I mean, they're all good intentioned people. But, so we're here talking about the structure and the governance model, not the work that they do. So we looked at the options. It has been 2008. At that point, 2 commissioners were on it. Chairman Hawley was the chairman, and we believe that Commissioner Mary Tannenberg was also on it originally. Somehow, it ended up in the planning department. We can't find any records of that being assigned to that office. I got the impression that it was originally supposed to be a temporary task force. Usually, task force have a certain timeline.
Yep.
So they were appointed in 2008, and here it is, 2020, and this board has never reconfirmed that, has not appointed people, there are no guidelines in place. So we're just trying to get some directions how to go forward. So we looked at the options, and there's 3 options. One, if you as a board decide to continue having them under the umbrella of the county government, then you should treat them the same as you do every other group where you appoint members. You have term limits, you have to approve their bylaws, their budget process. That's one option. Option 2 is they can form their own organization, and they can still operate the way they want to, they have their own membership. You still can allocate the money. The example, probably the best example of that is the Leelanau Family Coordinating Council.
LCSCC?
You allocate the funds every year, but you're not involved in their structure, how they operate, who sits on them.
But we do have representation.
Because you chose to, yes. And you could do that also with this group. The third option is they could be under another unit of government umbrella and still get the funding. Their big concern is about the funding from the county. And this year it's, how much?
$5,000.
$5,000. So under any of these scenarios, they could continue to get the funding if you choose. Obviously, if they're under the county umbrella, it's just an internal thing, so forth. If they're independent, like Leelanau Family Coordinating Council, we would have a contract with them. If they're under another agency, you would have a contract with that agency. So it's all doable. But Trudy won't say anything, but this has been an extra effort on her staff over the years. And really, it's not fall under the planning, it just happened to end up under the planning department temporary, and 12 years later, it's still there. But we really do need some clarification. We are concerned about the Open Meetings Act. We are concerned about their membership and who is entitled. Obviously, every other group and organization, every county resident is eligible to apply if they meet criteria. For example, Planning Commission has criteria, the Solid Waste Council has criteria, but you still appoint those people. We have no structure in place for Leelanau Clean Water, other than this resolution from 2008. So it probably should have been clarified many years ago. We're not blaming anyone, but we're just saying as we go forward, we need to clarify this because we are going to have some problems at some point.
Commissioner Ansel.
When I hear task force, that means to me, it was supposed to be a temporary thing, not a permanent thing. That's just, when I hear task force, that means we're going to address this problem and that's it. And that's my perspective on this. If it's a task force, you know, they're welcome to continue it, but not under the auspices of the county.
Commissioner Redmond.
Has anyone in the Clean Water, have they talked about not being a part of the group the way it is, or reorganizing, or?
We've had numerous meetings with them. We actually started back last February. We had a couple meetings in Chet's office with some of their, the chair and vice chair. And then we've been before some of their meetings and talked to them about different options. They've explored different options, and we've gotten different answers back and forth of what they want to do, or what some of them want to do and what others want to do. So there's no clear indication
Originally,
in my mind.
Originally, we asked them, hoping that they could develop a plan in August, and that way we could bring it back to the board. Then we said, well, let's set the goal of November, so when you do your committee of the whole, that we'd have a plan, that they would have a plan in place for you. And they keep, I think, good intention, but every time we meet with them, they have different suggestions, and they want us more time to look at it. We met with them last month, and they're gonna explore some options, and then they called me last week and wanted a couple more months to explore options. So we said, well, we're gonna put it on the board agenda. It really is, they can recommend, but it's your choice how to proceed.
Okay, so have they addressed each of these three options, and is there any kind of feeling, not without making a decision, but are they leaning in one direction? I mean, do they still want to be a part of the county?
It depends on which month we ask.
It depends on which member you talk to and which month.
It has changed a lot. The last word we heard from a few of them was that they wanted to come under the county umbrella, meaning be set up like a solid waste council or a county planning commission or Parks and Rec, whatever. I will tell you, in my opinion, of working with this group for all these years and having my staff be at the meetings and doing the minutes and, you know, arranging and helping them with everything, I don't think they're going to be happy with that. I don't think that that is the structure that's going to work for them. That's my opinion. I feel that they've kind of, as I use the words, outgrown where they're at right now, and they need to move on to another type of a format which will serve them better and give them more options.
And when you say that they've looked under other umbrellas, have they talked to Michigan State or to the Conservation District, or?
They have talked with Conservation District. They also have a member who's on the group who's from the Leelanau Conservancy, as well as from the Grand Traverse Bay and Grand Traverse Bay Watershed Center. Lake associations are all part of this organization as well, and none of those has panned out yet. So the last that we heard was that they wanted to come under the county's umbrella with applications being taken and appointments being made and so forth.
I can clarify. The chairman called, left a voice message for me saying that's what they wanted. However, next day I get a call from another member saying pretty much the opposite, that they want to be exploring other options. And then there was a follow-up email from them. So really, it's difficult to say because we get mixed messages from them every month now since last February.
Commissioner Walker.
Thank you. Commissioner Ansorgi hit the nail on the head. This was only set up as a task force to be a temporary task force. And we brought that up a few years back, and it was actually in this building, so I remember sitting down at the table and tried to eliminate the funding for this. And there was all sorts of uproar that, oh, you got to keep this going, etc. So there was some attempt to say, this is the end. It served its purpose because it had. And it was just supposed to be just what it says, a task force. So one of my feelings on this is that we've got so many organizations doing this very same thing that I think this group can easily come under one of those other umbrellas easily and out from under ours, which is where I would prefer that what we do with this is they can work with Soil Conservation District, they can work with the Conservancy, they can work with the Health Department, they could work with Leelanau Lake Association, and there was one more, and I can't think of right now which one it was. But there's lots of other organizations that I think would be much better served maybe being a coordinating effort under them, but not be under the county's umbrella.
Mr. Rush.
I do know, I've had a couple complaints from people who have tried to join that organization as members, and they were basically told they're not interested in their participation. I've also heard, I think they made the statement themselves. They didn't need the $5,000 that the county sends them. So I don't really think they need us to do what they're doing. And I would agree with Commissioner Ansorgi. Was a task force. In my mind, it should have been a temporary issue. And as Commissioner Lautner mentioned, this was addressed several years ago, and we got nowhere with it.
Commissioner Silverstein.
This has been a valuable resource for the county through the years, and I've often made the statement that if we had to pay for the expertise we've gotten for free, or for $5,000, it would have cost us a fortune. I think the composition on this board was based on expertise, and I'm looking now online at who's on the board, and basically it's pretty well balanced, representing all of the groups, because you've got two county people. You've got Steve Christensen representing the Drain Commission, and you've got Buzz Long representing the Conservation District, but then you've got Inland Seas represented, you've got the Grand Traverse Band represented, you've got the Lake Association represented, you've got the Conservancy represented, you've got the watershed of Grand Traverse Bay, you've got the Little Traverse Lake Conservationists, and the Glen Lake Association. So you've got a really good grouping of all of the different other organizations that are active, and this is kind of acted, it appears to be acting as kind of an umbrella. So I hate to see us kind of throw the baby out with the bathwater, so to speak. I wish we could find a home for it. I understand the frustrations and complications. I mean, Trudy, your department does an amazing job. I don't know how you do what you do, and I know that our clerk is inundated with minutes. If we could maybe look at moving them to the MSU Extension was mentioned here. Maybe that's an appropriate home or somewhere else. I understand the reticence to make it a formal committee, or excuse me, a board or a commission, and have more work done for a limited staff that's already doing a ton. But I really hope we come up with a suggestion other than just saying, we don't want your expertise anymore. Or we want you to be out somewhere else, but please do give us your expertise.
Commissioner West.
Yeah, I have attended several meetings. I'm aware of some of the work they're doing, and I think it's critical work. I understand the concerns that Chet and Michelle and Trudy have in terms of organizationally, but I think at least we need to help Leelanau Clean Water find a home, qualify for grants, have a place to meet, have a little bit of financial support, because resources, water resources in our county are pretty valuable, and they have a role to play. So I'd like not to make a quick decision, but I think we do need to make one. And I'm not opposed to having them be independent or going to it, but we have to help them find a home. We have to help them qualify for some grant money. We need to help them continue with their water quality research. They're doing marvelous things on Lake Leelanau and Little Glen. And we have lots of work to be done. I looked at our tentative list of goals that we're going to be talking about, and 4 or 5 of the goals on that sheet as draft goals related to some of what Leelanau Clean Water is doing. So I think we had to be too quick to just wash our hands with it, but help them find a better home, help them find a better structure, make sure that whoever's a part of Leelanau Clean Water, it's the right people that can do the mission of the group.
Commissioner Law.
I think that this group, they may be, and I'm sure there are, a very good grouping and even expertise, but they have outgrown this task force. So this task force said that it would be made up of and individual citizens of the county interested and involved in water quality. It didn't say there would be a board or a task force made up of just expertise, people of expertise in the field. It was supposed to be individual citizens. It's those individual citizens who have been denied an opportunity to be on that task force. So it isn't in its form it was intended to be. So that's why I think it's very important for us to allow them to move on and be under the structure that they want to be under. As far as dollars go, our measly $5,000 isn't, for these amount of people, that's not. Well,
It was $5, I think it's
has
been
been
reduced.
$5, and
Over
they
the
asked
years.
for it to be reduced, and I
Yeah,
don't.
several years ago, they did ask us to do it.
Okay, so for $2,000, they can do, as a lot of organizations I belong to, is we all pay $5 or $10 a year, some more, to be a member of that. And then you've got a real stake in that task force. So I think that it would be really prudent of us to allow them to go off and be their own entity and follow their own rules, write their own bylaws, and have the people that they choose to have on it. And they're a bright group of people. They really don't need us to do that for them.
Commissioner Retton.
As far as the financing is concerned, so you said they asked for a reduction, or they?
Several years ago, yeah.
And is it now 2,500 or?
It's changed over the years. They first started getting $5,000, and then they were, the projects they proposed were a smaller amount, so that went down, and then it went back up to nearly about $5,000. So the amount they've spent since their first budget of 2009 is just over $38,000. And then they did receive some 2% funds too that they had applied for over the years, so they used those on some projects. And then there's staff time, of course, which is not included in any of that.
Yeah. And Michelle, the amount of money that we contract with the coordinating council, is that about 50?
It is, but remember that goes to a separate nonprofit, and we're not involved like we have to be.
Right, no, I know it's a contract, I just wondered, what the difference was in the amounts, and, if it was possible for us to maybe work it through a contract with them and come up with some.
If I could add real quickly, that was a suggestion that was given to them a couple of times, is that they could go into the clerk's office, file a DBA for a very small amount of money, and work with the county on some type of contractual agreement similar to other organizations. So that was one of the options.
Yeah, let me follow up on that, because that actually, based on what Trudy's perception is, Michelle's and mine, I think we're all kind of saying the same thing. We all agree that they do great work. What they want to do, actually, the Open Meetings Act stifles some of that. They want to have certain things where they just have open dialogue and everyone participates. And we're saying you can't really do that under this structure. So that's a challenge for them. But in a perfect world, if we structure them this was actually my idea, they can form a DBA. They can be under another umbrella, or they can form a DBA. They don't have to be a non-profit. That's a whole separate process. If they want to go through that, that's fine. But we could enter into an agreement with them. Every time we approve a 2%, for example, with just the one last year with the Leelanau Cancer Foundation, we had to draw up a contract because we cannot donate money. But let's say they follow DBA and become Leelanau Clean Water. They still can meet here. We let groups meet here all the time, so that's not an issue. They can set their membership, they can set their bylaws, they can determine how they want to have their meetings. You still can allocate money to them. Because of this legal partnership, they still could apply through the county for grants if you so agreed to it. So to me, I think that'd be a great solution to accomplish their goals, to avoid any potential issues with the Open Meetings Act, to avoid going through the process of nominating people and approving them and people applying that they may not want to go through. It just seems like a good solution.
I wasn't quite finished with what I was saying, but to finish what I was saying is that would totally relieve the planning department from all minute taking or record keeping or anything. The only thing is it would still involve the clerk's office as far as scheduling meetings and so on.
We would be happy to schedule the meetings, but this has become extremely labor intensive, and not just anyone on staff is able to sit in these meetings. It's really outside the box of how we do business here.
Yeah,
But
I understand
scheduling
that.
the meeting's easy.
But I mean,
The
it's not
agencies-
like anything else, but.
No, but like an agency that wants to reserve a room
Yeah,
and use it, that would still be a
Right.
possibility for sure.
We open up these facilities for a lot of agencies, so that's not even an issue.
Yeah. That
They
seems-
continue to have their meetings here,
Yeah.
if they chose to.
That seems to me the way that, it would be an obvious, easy way for them to go. They'd have to keep their own minutes.
They need to.
I have a procedural question for the clerk. If this was done by resolution, do we have to rescind the resolution?
I don't know if you just need to rescind the resolution or just say, you could, you've done it with ordinances.
Okay. So I would recommend to the Board of Commissioners to rescind Resolution 2008-028.
I'll support.
Go ahead.
Okay, thank you. I think that would do, by rescinding this resolution, it gets rid of this task force. This organization, this group already knows what they want, and what they want to be and how they want to be. I think this will allow them now the legs to stand up and be who they want to be, operate as they choose to be. I think that it's going to free the bonds for them to do an even better job for us.
I think it's premature to withdraw the resolution until we have another option in place. I don't want the headline of today's meeting being that the county commission disbanded Leelanau Clean Water. I think we need to work with Leelanau Clean Water and have another option that we then, in a very thoughtful way, can approve and support and have them move on.
Well, I agree with what you're saying, but I also, if they've been working with them since February and haven't gotten a decision, maybe this will make them come to us with a decision, what they want, and how they want to organize themselves. And we can just, work towards reorganizing it.
Well, making it the best of both worlds and if you let them know that you encourage their work, you support them, you want to have a deadline date, set a deadline date, that this transition by July 1st, for example. That gives them time to transition, you're not kicking them out, that this is January, I just say July 1st, that's how we through the budget here. We could, by that time, draft up an agreement with them, so they know that we're still supporting them. And I really think that's kind of a win-win for both groups. It's good for the commissioners, it states that you support their efforts, however, it forces them to get a structure in place by July 1st, which really, I think, when you listen to what they want to do, really meets their needs.
Okay. Commissioner Rush.
And that's basically what I was going to say is, you've been working with them, the three of you have been working with them for several months now, and you can't seem to get a consensus from the organization. And I think we all agree that they do an important work, but the problem here is they don't want to conform to the type of regulations that is imposed upon them by being under the umbrella of the government. So let them do what they want to do. Let them do what they do best. And, you know, we've tried this route. Give them an opportunity, let them make decisions about, you know, where they want to go, who they want to be, but they haven't taken any action. And sometimes you have to force the issue. And I will support this motion today in order to kickstart that process.
And the three of us will be glad to work with them to help them with this process. We're not going to just kick them off.
Right.
You know, they're meeting tomorrow morning. I'd be glad to come and give them an update. What I'm not hearing from anyone that you want to disband them. You're not saying you want to cut their fundings off. You're basically saying you'd like to have a new structure in place that actually suits their needs and their goals and objectives much better than the current structure. Because they feel frustrated when Gail's trying to take minutes, always has to remind them about, no, you can't do this, you can't do that. No, you, an audience, cannot vote at this time on this issue. If they want to have more open dialogue, which is, I think, suits their goals better.
Right.
So we'd be glad to work with them, let's just say July 1st, to have the whole structure in place to make this conversion as easy as possible.
So, Mr. Chairman, if I read what everyone is saying, or maybe as flavor at the time, are you looking for me to amend my motion to put the sunset clause on of
July 1st.
July 1st? Okay. I would amend my motion to do that.
I'll support that.
So any other comments? Okay, all those in favor of the amendment?
Aye.
Okay, so then now we have an amended motion. All those in favor of the motion amended?
Aye.
So that's all right, thank you.
Thank you. Thank you.
So then that brings us to salary update. No, the goals. We're on the goals. What I'd like to do is everyone just do five, tell him your top five of the list that we have, and then we can have those as a top five to look at. I mean, and rather than us go through it all right now.
Does everyone have a copy of my memo? I put them on your desk. So for those of you that responded by yesterday, I took all those, some of them I combined them, so the words that you gave me may not be exact what's on them, because several people put them together, so instead of listening to the same goal 3 times, I kind of did my best to try to condense them. So I tried to capture the flavor. Some of them, the wording just made different because a couple of you may have had the same goal. There's a couple of them that 3 of you had the same goal and everything, so I'll get you a copy of that too.
Yes.
I understand why you're making that request. I would prefer that we give it a little bit more time. There's some goals here that I've just read at break time that I don't even know any of the background on. And I think the people that advance those as goals ought to take maybe 2 minutes, not today because it's late, but before we decide to prioritize them, I'd like to see the thinking that people had on.
So we can move it forward then to next week and try it then, see how it goes.
I made the motion to move it forward.
Okay.
Do I have a second?
Yes, second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Thank you very much for that. Okay, so then that brings us to the county administrator responsibility, salary update.
What you asked last month is to do a survey of that survey and add how many departments each administrator supervised and how many total employees, so you have those results. One county, I think the only county that did not respond was, I believe, was Lake. I don't have I don't know what happened to my sheet here.
That was Grand Traverse County.
Grand Traverse was not part of the original one, I just added them.
Oh.
Because someone asked about Grand Traverse. There was one county that did not respond, you can see it's blank.
Yeah.
I can't remember which one it was, but every other county responded.
Oh, these are business right here.
Yeah, it was, oh, no, this one did not respond.
Oh,
Which one did not respond?
Misaki.
No,
That's what he said.
no.
Osceola?
Osceola, yes. So if you look at, you have a number, if you look at the third column over, there's, like, for example, Antrim, it's
Oh, I
11 and
see.
52. So there's 11 departments, 52 employees. So all elected officials and their staff were not included. Because that's separate.
Commissioner West.
Yes, Mr. Chair, we have a very experienced county administrator, the most seniority of any administrator in our county and more than most in any other county. We have a larger number of departments than many of the counties, and in some respects are more like Grand Traverse County in terms of expectations for county government than some of the other counties. I think we should entertain discussion of having, we also have an administrator that just fared very well on his evaluation. And I think we ought to have some discussion about a longevity / merit adjustment to the administrator's salary.
Commissioner Ansel.
My preference would be to do this during budget time when we should be doing that kind of thing, not this time of year. I'm done.
Commissioner Walker.
I don't disagree with that. Did we just give the administrator a 3% raise with all the non-elected or
2.1.
The 2.5? So you got the 2.5 and you've gotten other,
The same as every other.
same as every other.
Town employees.
So we started you out at 85,000, correct? Or did we start you out lower?
I don't.
So is 85 today with all the percentages over the years, County Clerk?
Yes, that's true.
So it's up to 85 since we've been giving our administrators.
Whenever we adjust the administrator's position, just the same as.
So we really are the only ones who haven't adjusted our salary, is that correct? So you are up, you've gotten the increases.
No, yeah, same as every other employee.
Okay.
Since I've been here.
Okay, I just wanted to make sure that have gotten
Yes.
those.
Yes.
Okay, okay.
Personal days are higher than other administrators. On other boards that I serve on, when we look at additional annual stipend, it's usually based on merit. And over the years, we assign certain things to be accomplished by that director, and if that director accomplishes those things over and above his required duties, then annual stipend is considered on a merit basis. We have an employee that is almost at the top, if not at the top, of the salary range and compared to others. Not quite at the top, but quite near the top, second from the top, I do believe, with extra personal days. And he is allocated a raise every year. And when you ask the administrator, he's comfortable at the position he's in, at the pay he's receiving, and the increases annually. So personally, I see no need to increase the salary or add funding to his salary unless we as a board decide that there's additional work that needs to be taken on by the director or the administrator.
Any other comments? Commissioner Love?
Well, I was just going to say, I agree with Mr. Ansori that this is something we could discuss at budget time. But we've been negotiating really hard to get away from longevity, so I couldn't support any kind of a longevity, even for administrator, because I think that would just
snowball.
I was going to say kick us in the butt at negotiation time, but yeah, snowball. And merit, we haven't done, and we don't do merit raises here, haven't, at least even for our administrator in the past. Adjustments, yes. There could be negotiations if our administrator, you could think about this, if you want to come back and say, hey, I just need 3 more vacation days or whatever. I've not heard from our administrator that there's anything that he would, request, or even a salary level he'd like to be at. I'd be open to hearing something if there is a request. But I guess right now, I'm not just going to throw anything out there and vote on it, because I don't know.
Commissioner West?
Well, I know from where our administrator came from, and I know he took a pay cut to come here. I know when I look around the county and look at people with similar kinds of administrative responsibility, they're making more. There's a superintendent in Northport with 150 kids that is making much more than our administrator. The budget is more, the responsibility is more. I think that when you look at where he stands with the counties listed, yes, he's near the top. But if you look at other counties around the state with similar responsibilities to what he has, or you go next door to Grand Traverse County, the budget is more, the expectations are more, the departments are more. I'm not opposed to looking at it at budget time, but I wouldn't assume he'll ever come to us and say he's dissatisfied. But we could also have said, would you appreciate more? And I bet he'd answer that in the affirmative as well.
Well,
Who would?
exactly. Who wouldn't?
So I would still like to see an adjustment.
Commissioner?
Yeah, I think an adjustment was a nice idea too, and I would support that. We talked once before about this, and I said something about doing a bonus, and I know we can't bonus employees, but is there another word that can, a lump sum can be appropriated to a...
Like a one-time allowance?
Yes, a one-time allowance to be...
Allowance from what?
Take me completely out of it. Administrators are a unique position because we have a contract specifically for that person. So we're not covered by the union, we're not covered by the employee groups and so forth. So it is a unique situation.
Okay, so if we wanted to show our appreciation for the fine talents that you provide to us, we could make a one-time allowance and show you our gratitude. Yeah.
When does the contract, when does contract expire?
Well, you switched it several years ago. It's a 3-year contract. Unless you vote in June, another year gets added to the contract.
Okay, so when does your 3-year contract expire?
Well, now 3 years in advance now, so this is 2019, so 2022.
Okay.
But unless you vote in June next year, another year gets added to it.
Okay.
We could put a sunset clause
Yes,
in.
you could. It's a revolving, you switched that several years ago to a 3-year revolving contract. So
Okay.
every June, I can't remember, June 1st or July 1st, actually. There's a
Okay.
deadline date.
We don't want to pop you into that higher tax bracket.
No comment.
I would say that, this board seems to have a preponderance for spending other people's money. We're really good at spending it. And I think Chet's doing a great job, but I think he's paid well. Yes, it bothers me that superintendents are paid so high, because that money comes right from the kids. You know, so because they are out of proportion in Leelanau County, we don't want to start doing that here. So, I mean, I would not, I don't have any problems with the administrator or what he's doing, but I am not willing to vote for a bonus, an allowance, a stipend, or whatever you want to call it, or added wages. He will get a 2.5% increase already, and I think that that's more than sufficient. That's more than any of the people that I work with will get this year. Commissioner Ansel.
We also have to take into account that he's working in Leelanau County. You know, you look at, you look at Grand Traverse County and the headaches that they have, and, I am so thankful that we're not in that same situation, and our administrator doesn't have to deal with all those issues that Grand Traverse County is dealing with. And it's the same for deputies or anything else, There are multiple deputies that would love to come work in Leelanau County because we don't have the problems. We don't have those same problems. So you got to realize, there's a benefit to working in Leelanau County too. Besides, getting to deal with us.
That's a benefit, right?
Yeah.
So I'd like to move on to the POAM Road Patrol update.
Yes, allowed by state law, I'd like to go in a quick closed session to give you an update on negotiations.
So moved.
I would move into closed session. Commissioner Wessel has made that motion. Do we have a second?
I'll second.
Okay. Now let's have a roll call vote.
Commissioner Wessel?
Yes.
Commissioner Answorthy?
Yes.
Chairman Bonick?
Yes.
Commissioner Lautner?
Yes.
Commissioner Rettenbach?
Yes.
Commissioner Rushton?
Yes.
Commissioner Cecil?
Yes.
7-0.
We have a motion to come back into session.
I'll make that motion to come back into regular session.
Support.
All those in favor?
Aye.
All those opposed? Okay, we are now back in session here. All right, so now we're on to review of financials. Go ahead.
My computer's dead and I can't open it, but I have, under report 1, there was something about the Timberley Drain Association. I think I've asked that question before. They're paying for that drain district, right? Is that one's
I don't know about
already set up?
Kimberly. That was set up, are you talking about the past one?
Yeah, we just had a bill for it. It was in report 1, page,
I think he's
one, I
looking
think.
at starting.
I think I started another one.
Oh, it's a
There are
separate-
2 districts now, because I know, because I'm paying
Yeah,
for that.
that's what
Those
I
are
thought.
separate, but I think they're exploring a
Report
3rd
one, maybe
district.
page 1.
I think they're starting
The Mount
Uh,
Josh
Mount
Road.
Mount Josh, yes. They're off where, it's between Lake Shore subdivision and the main entrance to Timberley. There's Mount Josh Road, which has had major problems.
Yeah, it's actually right on the county line.
That's right. between-
Township line.
Township line, yes.
Yes, Mount Josh, okay. All right. Page 3, we had, I see. Page 3, we had Mitchell Graphics, and that ended up being, I just saw the box and I brought them in, that was all these postcards. So we spent $1,000 under a year putting out this flyer.
That's, you'll know, clean water. Yes.
Yep, but it came through planning. So, 5,000, who are they going to go to? It's only 5,000, that's not, we have more households than that, so I was just curious about that.
Generally, they see spending money.
Well, it's year-end spending the money, and that's exactly what I thought. I mean, I've read it, I guess it's a lot of stuff that makes sense, it's educational, but I don't know who's gonna get it. It's all kind of stuff we've covered, same stuff we've covered year after year. All right, and then in the next report, we had, on page 1, vendor, I think is Greenstone, there was a bond. Page 1, is it Greenstone? Yes, what is Greenstone Insurance Company bond?
That's the bond that we treasurers was, how much was that? 101?
2,500.
I saw that when I approved that. What page was that?
So he,
What page?
You have to pay a bond to bond your treasurers for tax
page
collections.
1 on the report 2 for claims, okay. But what was it, is this a short-term bond for, is transferring some money or something?
I think every year, Michelle, help me out here.
Pay for tax collection, bond
Yeah.
your treasurers to pay for their tax collection.
Oh, okay, all right.
It's an annual
Okay.
expense.
Gotcha, okay. All right, and then Michelle, in claim, in post audit, I think we have 2 different MMR. One was like 95,000, one maybe 15,000. One is the jail and one is our other employees.
I can send you a copy of that and give you explanation.
That's what it is, isn't it, though? It's one,
MRMA, I thought that was replenishing our funds. The making so many bills. What page is that on?
I didn't write it down, it was in the, I think that was in post.
I will look that up and I'll email all of you the answer to that.
Okay.
Is that what you were looking for?
No, I think there were 2 right in a row, but that's okay, I'll get, that was the only thing I had, so thank you.
Anyone else? Do we have any special reports?
Yes. I have the results of the chili cook-off.
Ooh.
All right. Tie for second, we'll go backwards here. We have Molly Steck's smoked chicken chili and Michelle Crocker beef bacon chili.
Ooh.
I did see Michelle by the ballot box by herself.
Yeah.
And the winner, first prize, is the white chicken chili by Ron Pomunda.
No way. White chicken, how did it win? Well,
The
now I
people
thought it
have
was,
spoken.
wasn't that its own category? So did he win and
I
Michelle
just
won?
have the results here.
Bobby had smoked chicken chili.
The
so
election
only
commission
real
will
chili
get
was
together and
Michelle.
validate the ballots, I'm sure. Right, Michelle?
That's right.
So, thought you should know.
All I can say on that topic is, that's the chili that was gone.
That's right.
It was.
In this contest, there are no losers.
Okay. All right, any special reports?
Eric, need this result?
Other than that,
There.
and public comment?
Oh, here's my public comment now.
Still only have 5
Tricia
minutes.
Denton, still live in Cleveland Township. Now my eyes are dilated from the doctor's appointment in between, so please bear with me. Thank the commission for their support of digitization of the health department's records. I'm very excited about that project, not just as a resident of the county, but as a person who works with water and public health. So thank you for your support of that project. The other thing that I wanted to speak to was the Leelanau Clean Water flyer that was mentioned. This was a educational piece that was developed based on feedback that we heard from the commissioners as well as other folks in the community. They were looking for something compact, concise, easy to understand that covered a lot of the topics regarding water protection and protecting in our economy. That would be easy to distribute. This was developed by the Glen Lake Crystal River Watershed Protection Project and paid for by the Glen Lake Association. The development of this brochure was with input from representatives from Township Zoning, the Soil Conservation District, our Drain Commissioner, Steve Christensen, as well as other folks in Extension and other lake associations in the county. So the Glen Lake Association has printed an additional approximately 6,000 of these and is paying for them to be mailed to every resident of Cleveland, Casson, Glen Arbor, and Empire Township. I also participate in the Leelanau Clean Water Group, and as such, as was mentioned, there was money remaining in the budget for that this year, and we wanted to be able to expand the distribution of this informational pamphlet to as many other folks in the county as possible. So with that money remaining in the budget, we paid for an additional printing at a subsequent cost savings because
the other organization had already developed a mailer. And we are planning to distribute it via upcoming forums, events. It will be displayed in the informational kiosks around the government center and be available to anybody who thinks they can distribute them. Whether or not that group might vote to, or the county would allocate funding to do a mailing of them, is something that could be decided at a future date. So thank you again for your support of Leelanau Clean Water, and I hear that you're moving forward with a way for a tree planting to occur, and I appreciate the consideration of that as well. Thanks.
Any other public comment? Seeing none, we'll move to commissioners' comments. I just had one. I was just surprised when Lou Walter said that we've added 17 people to our payroll.
Well,
Yes.
did we add 17 people, or is that 17 people that are now taking the insurance that
They
weren't
switched
before?
from per diem.
Right?
They get a monthly stipend if they choose not to.
Okay, but turnover, but not new employees then? Right.
There have no positions added, we
Yeah.
had turnover, and some switch from buyout to our insurance. They can only do that if they've lost their coverage or during our annual reopening, but we did have more this year, and we've had a few significant.
Yeah, and then some people may have retired who were getting the buyout, but the new people hired in place are taking the insurance. So no, obviously you would know if we had a person.
Well, that's what I wondered.
It has to be approved by.
So I've misunderstood it, so that's good.
No, it's the first thing that crossed my mind, that I'm out choked too. I'm like, what?
Well, and one thing I was concerned or thinking about is the milfoil that's become a problem in the lakes, and that maybe that's something that if we talk about Leelanau Clean Water, we could talk about them. They are looking into it. It's just something that came to my mind later on after we had a discussion about it.
Well, it's the best weight loss and hair growth treatment there is. So if people just go out and pull all the milfoil out of the lakes and ponds and rub it all over their hands, then that's what that does. So
Okay.
that'll solve our milfoil.
Any other commissioner comment?
It's late.
No. So then that brings us to I don't have any amendments or transfers, but what about claims and accounts? Yes, Commissioner.
I would recommend approval of claims and accounts, $400,813.25.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Recommend to approve post audit $1,365,746.79.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. We are adjourned.
Eric?
What?
You guys